And for December 13, 2021, entertain a motion to approve the agenda by Mr. Smithers, seconded by Mr. Perkins. Any discussion? If none, all in favor? Aye. Opposed? Carried. The first topic is from the Office of the Aging, Andrea McDonald.
Good evening.
Okay, so we have a resolution authorizing the chair to sign the 2022 annual update plan for funding from the New York State Office for the Aging. Moved by Mr. Denisha, seconded by Mr. Smithers.
Okay, good evening. So this is our annual plan for funding update. So for 2022, no big changes with this. We're hoping actually at this point, it looks pretty good for our allocations to remain as they were for the next upcoming year, if not slightly increased.
Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Anything else, Andrea?
No, that's it. Thank you. Have a good evening.
Thank you very much. Have a great evening.
You too.
And the second resolution is from Public Health, and it's modifying the 2021 budget for Public Health Department for the Coroner's Program. Moved by Ms. Curran, seconded by Mr. Akers. Jolene, go ahead.
Thank you. So due to higher than anticipated expenses, we have had to transport most of our autopsies out of county for this year due to medical reasons with our medical examiner and the higher number of autopsies. So through November, we had done 91 so far. Last year, we had only done 62 for the entire year. We are looking to increase appropriations for $140,000 to cover the cost of the coroner's program.
Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Jolene, thank you, unless you have something else.
Oh, thank you.
The next is from Social Services, a resolution modifying the 2021 budget for social services for transportation costs related to Family First. Motion by Mr. Denisha, seconded by Ms. Curran. Mr. Akers. Heather Rand. Heather, are you with us?
He's on.
Okay. Can you hear her? Heather,
I'm
can you hear us?
Joe, are you looking for me? I'm sorry.
Yes, yes.
Okay.
I just read the resolution of modifying your budget for transportation costs. Would you care to speak to it, please?
Turn on my video. Sure. So the budget request is in regards to parenting transportation. So this is the transportation cost related to transporting parents with services cases to service providers, and also for volunteer driver costs associated with supervised visitation. So we saw an increase in that cost, but it is related to the compliance with court-ordered supervised visitation for parents with children. It's offset by revenue that's received from an over budgeted amount in another account and reimbursement that's received as well.
For any discussion? Seeing none, all in favor?
Aye.
Any opposed? Carried. The statistical information, if you want to go right to that, Heather.
Sure. And I'm hoping, yes, thank you. Okay, so tonight we'll take a look at the statistics for St. Lawrence County Department of Social Service for the month of November. The agency saw 155 new child protective referrals for the month of November compared to 159 for October. So very similar numbers. And overall, the number of children on the new cases increased from 317 last month to 332 through the end of November. So if we look at our indicated, unfounded, and family assessment response data, our indication rate did rise slightly from 16% last month to 18% for November. And I say last month, but the previous statistics. The unfounded is also an increase from the yearly average, 71% compared to the 61% for the yearly average. The yearly indication rate has remained at 19%. As you recall, the New York State average and the federal U.S. Department of Health and Human Services average is between 15 and 16%. So we continue to keep an eye on that, especially when we are above the 15 to 16%. You may recall the discussion last month regarding the changes to the New York State Central Registry reform that will begin in a couple short weeks. Currently, the burden of proof to indicate and substantiate a child protective report is some credible evidence. This evidentiary standard will be changing to a greater fair preponderance of the evidence in 2022, which is consistent with the standard of proof required should an individual request a fair hearing on the indication. So in summary, as we discussed last time, currently a child protective services report could be accurately and justly indicated or substantiated for allegations, but overturned at the fair hearing level due to a higher burden of proof required in the hearing. There will be a transition period during the first quarter of 2022. However, it's hopeful that the alignment of the standards will result in a more consistent indication rate and fair hearing determinations. So as we move on to our safety checks completed on time, Child Protective Services saw a nice increase back to the 97% of safety assessments completed in connections compared with the state average of 90%. Moving on to the next page, the average CPS caseload has stayed pretty steady since September, ranging from 24 to 26 cases per worker. November saw a caseload size of 25 cases per worker. And again, that's compared with the OCFS recommended caseload max of 15. For our total caseloads sizes, we have 669 total CPS cases open right now, compared to 651 from last month. Child Protective Services staff were able to close 43 cases during the month of November. And as we break the cases down per month by supervisor, I won't go into a lot of detail unless anyone has questions regarding the specific units. I'll just note that you may see some of the more seasoned workers may have taken some more cases than the newer workers. That's due to training requirements and the difficulty of some of the cases. Also, we had a worker in one of the units transition out, which is why you see a closing of 12 cases. On that next page, starting with unit 5478. Again, new employees are getting into the rotation. So you see some of those 0-year employees starting to receive some cases. And we hope that as we continue, we have 2 trainees who will complete training this month. So hopefully cases will be able to be distributed more evenly when we're including some of the newer employees as well. CPS lost 1 probationary staff in the month of November. We do have 2 CPS staff that are out on longer term leaves. And as I mentioned, we hope that as new employees are trained, cases can be more evenly distributed to provide some relief to those employees that have been receiving the larger volume of the new cases. As we look at the cases closed for Child Protective Services, you tend to see smaller numbers in the first band. Again, that's because some of our new employees are just starting to receive cases. So the cases that are more recent would not yet be ready to be closed. And as we move into preventive services and our foster care numbers, we saw another decrease slightly in the number of children in care from 308 to 303. The staff are continuing to work diligently to reduce the number of children in care. So we are pleased to see the number continue to decrease. We saw 7 children enter care for the month of November and 12 were removed from care. In the average number of children in care, it continues to decrease from 324 last month to 322 in November. And when we're looking at the average days in care, something that we continue to struggle with, this is an area the agency will continue to work on, and we do hope to see a vast improvement in the new year. The average number of days in care right now is 695. We look at the average number of children receiving in-home services. November saw another decrease in the number of families receiving those in-home preventive services. Again, this could be contributed to an increase in more complex and difficult placement cases, or the use of more community-based services without the department's intervention. Caseload sizes have remained, as you may recall, steady at about 12. So we're at 12 again this month. We're looking at the cases per month by supervisor. You'll see in the very first unit a decrease in 10. It actually wasn't 10 cases that closed. We had a worker that had resigned and the cases were redistributed. So that's why you see at least 9 of those cases redistributed within that unit. And the only other mention would be that, again, we're not seeing a whole lot of movement across the units in case distribution or overall caseload sizes and preventive services. They're staying about steady in all of the units with minor changes. So next I'll speak briefly to the home finding unit. Just want to point out that our home finding supervisor moved from a caseworker to a supervisor position. And that's why you see the decrease in the 19 and the 13 homes that she covered. And those were redistributed to the workers within the unit for an overall increase of 3 foster homes for the month of November. And again, looking at the trainee period, we have 1 staff in services that will be completing training this month. And cases closed across preventive services. Those services typically, as we discussed before, they coincide with court orders that are extended for 6 to 12 months periods at a time. So often we don't see large groupings of cases being closed. And again, that 10 cases closed were actually redistributed to other workers. So if we move on to our adoption activity, we did have 5 children that were adopted in the month of November. That was an increase from 2 the month before. We have an additional 2 children that are freed without an adoptive resource, and the remaining 53 children are freed with an adoptive resource. It's been noted in previous meetings by, I believe, Legislator Akers that the number of children being freed did not equate to the number of children being adopted each month, and the gaps seem to be growing. In past meetings, the county attorney has provided information regarding the process and the extent to which the court's calendar may play a role in the timeliness of adoption. I wanted to provide some additional context into why adoptions can sometimes take longer than what is hoped for. Children are freed for adoption through legal surrenders by parents, termination of parental rights, or abandonment proceedings. Orders must be personally served on parents. The agency is tasked with locating and serving absent parents. This can be an incredibly difficult task when parents are homeless, have moved out of the area, or have not maintained contact with relatives or the agency. Once service on the parent is completed, there's a mandatory 30-day wait to allow a parent to file a notice of appeal on the court's decision with the Supreme Court Appellate Division. If an appeal is filed, the process could take months and in some instances has taken over a year to complete. After the 30-day wait and verification that no appeal is pending, the agency may file the adoption packet with the court. The court requires certified birth certificates and in some instances, death certificates of deceased biological parents. These requests can sometimes take months and provide another barrier to timeliness. If the children being adopted are eligible for a handicapped subsidy, the agency must obtain documentation signed by a physician or psychologist specifying the conditions. There must be an original signature and the evaluation must be recent. The adoption packet also requires recent well child and dental exams. In addition to these requirements, the New York State Office of Children and Family Services implemented new standards this past summer that requires all foster homes who are adopting to be certified as adoption-only homes for the purposes of subsidy payments. This process has been proven to be quite cumbersome and very time-consuming. The additional New York State requirements, documentation, and various components of the court process are just some of the barriers that prolong and compound the adoption process. The agency hopes to establish a better means to expedite completing these requirements moving forward, including the potential of a New York State Office of Children and Family Services assisted project with the new family court judge so that freed children can achieve more timely permanency. So in the last block of child welfare data, overall in review of our foster care placements, I like to provide the board with an update specifically to the agency's compliance with the Family First standards and the requirements. They require institutional rates to be below 8%. Ours are at 4% for St. Lawrence County. And they require relative foster home placements to be greater than 50%, and St. Lawrence County's at 58%. So we have and continue to meet the federal and state Family First standards and requirements. In addition, I wanted to provide the board with just a real quick update on DSS employees as foster parents, the numbers. So last month, there were 10 St. Lawrence County youth being fostered by agency staff. This month, there are 9, as one child has been adopted. Also, 3 of those children are slated to return home on trial basis to family before the holiday. So I just wanted to provide those numbers. They're not on your data sheet, but. And then just looking at the eligibility programs, there was an increase when looking at the individuals. There's an increase across the board in temporary assistance, SNAP, and medical assistance individual applications and those receiving those services. There was a decrease in the HEAP applications, and right now HEAP is receiving regular applications, heating equipment, repair and replacement, and clean and tune program applications. And I believe there was a question a few months ago regarding individuals with HEAP credits on their account. I did find out that those credits are allowed to remain on the account for up to 24 months, at which time they are to be refunded back to the program. So those are the statistics for November.
I think we're on some type of freeze.
Were you addressing that too, Heather?
Yeah, I was, Joe.
Okay. Heather, you're muted.
I'm muted.
Did you get Mr. Jerk? Mr. Burke?
Nice job. Freudian slip, John.
I did not hear any questions. If a question was asked, any.
All right, he can repeat it. Go ahead, John.
On the chart, the average days children have been in care. We're at 695 for 2021. And I guess I'm just wondering if you have any thoughts as to the cause of that, or what contributes to that number.
That is a statistic that we have continuously struggled with. And what I believe pulls that statistic and that number up are unfortunately the children that don't have a resource, the children that remain in care without a resource, some of them with severe behavioral problems, some of them unfortunately in residential care. But I believe that those are some of our children who have been in care the longest. And yeah, I think that may be one of the reasons for the number being higher than we would like it to be.
Thank you.
Mr. Denisha?
Thank you, Chairman. Heather, I just wanted to thank you for, I know last month I got asked about the balance or the credit on the heat accounts.
Yeah.
And I thank you for explaining that.
Mr. Smithers?
Yeah, Heather, the average preventive caseload, I'm looking at on page 5, I'm looking at average caseload of 11 and 12. Do you have a state recommended figure for that, like you do for the other department?
No. We don't really have as concrete of a standard with preventive and foster care cases by the state. We do with Child Protective Services. Child Protective Services, New York State actually issues reports specific to 15 or more cases. So we don't have anything as concrete. There are certainly studies that have been done both in New York State and across the country that will give you recommendations of how many children per caseworker there should be, but it's not been adopted by New York State to the level that Child Protective Services investigations have.
Yes.
As a follow-up, Heather, then I'm looking at average caseload for the CPS. And my question is, how much mobility is there in employees, particularly perhaps in recent hires, to go from the CPS to the preventive services? Do we have any mobility there or ability to shift back and forth to try to alleviate some of the over numbers in the CPS department?
So what you're asking, if I'm hearing you correctly, is can we move caseworkers from foster care preventive to Child Protective Services? I don't believe that it's that we cannot move people. There is a difference, a different rate of pay right now. But I think that it's difficult to look at the average caseload in preventive and see the numbers be so different from the investigations without giving a little more context. For example, investigations can be open up to 60 days and then are typically closed, whereas services cases are open a longer period of time. They involve many more layers, including court work, including sometimes visitation, and those preventive cases also include foster care cases. So they're not just preventive, they're also our foster children as well. So it's not really apples to apples, I guess is what I'm saying. If that helps at all.
Mr. Akers?
Heather, thank you for explaining the timelines as far as the adoption. The termination of parents' rights, is there a variety of a timetable? Because certainly you may have parents that are incarcerated and have drug issues or whatever. Do they, at what point in time are the parents asked to sign off on their parental rights to that child?
Sure. So right now, if your child remains in care for 15 out of the most recent 22 months, then the department will look at the case and, move towards that concurrent planning, which may be freeing the child for adoption. We take many factors into account if the family is progressing. It may not be that it's in the child's best interest at that time to move towards termination. If it looks like a home on trial basis may occur. However, if that is not the case, then 15 out of 22 months is when the department moves to file the termination of parental rights petition.
So in that case, in the 15 out of 22 months, what if there is not a direct parent, but a grandparent or some type of kinship that expresses interest in actually fostering that child and maybe moving on to adoption? How does that work out?
So we've had many different scenarios that have included family members finding out or coming forward later into the case. And it is a bit more complicated. We are required by law to always look into family. And a lot of times the decision is put before the court. They are provided with the information. We usually complete a home study on that relative. We provide the information to the court, and the court will ultimately make the decision regarding moving the child to a relative or leaving the child in their current placement that may or may not include placement with siblings, maybe with another relative, or it may be in a foster home.
Okay, thank you for that explanation. On a different matter, on one of your previous speaking to the board, you mentioned about the type of supervision, the protocols for supervision for caseworkers who are actually the supervisors of a child that DSS employees have. And you mentioned about the sensitivity. I won't say the names, but they were revealed in public comment last month, or actually last week, 2 weeks ago, whatever it was, that this individual read off an email, which actually was the actual foster parent DSS employee, where a comment was made to that individual by the visitation supervisor. And it basically, I wondered about the protocols, whether the visitation supervisor should have made that comment to the DSS employee who was the foster parent of this child concerning future placement. I was wondering if you had addressed that, or can you speak to that?
I understand there was a request this past week made to the county administrator to follow up on some information that had been received. Without getting into specifics, information of that nature would not have come through the New York State connections or computer system that I spoke about last month. The information relayed to the board detailed the system put in place by New York State Office of Children and Family Services, whereby across New York State, cases can be marked sensitive to restrict access for reasons pertinent to case composition and staffing. The system for years is very successful in preventing access to the connection system by any staff without those permissions. I think we also discussed that in addition to that, St. Lawrence County conducts meetings regarding sensitive cases and private settings where we discuss board rates, permanency planning, safety planning, casework activities. Unfortunately, the agency does not operate within a vacuum. Every single case, preventive, foster care, adoption, has layers of outside agencies, community providers, supervised visitation alone. We collaborate and work in partnership with 3 other agencies and volunteers from the community to provide supervised visitation to those cases. So, we do work very closely with other agencies and all of the people that provide services to us. And our expectations are the same for all of those agencies and all of those providers. I hope that answers the question.
Well, I think, in a roundabout way, maybe, but it actually is a specific example where in the email, the DSS employee / foster parent, in written form, to the attorney for the child had made a comment, and I don't remember, I don't have the words in front of me, that specific information was passed by the visitation supervisor to that individual, which to me seemed like a conflict as far as sensitivity. And I spoke to County Administrator Ruth Doyle, I'm assuming that she spoke to you about looking into that. Because of the sensitive nature, I don't want to reveal names, but it's the public record. And I thought, based on the protocols that you had expressed to us and what you just did here again, that this was a violation, or it didn't look kosher, that's for sure. But thank you.
Anyone else? Mr. Reagan.
Heather, I find it interesting that the temporary assistance programs are down dramatically over the past 3 years, both for individuals and families cases. Do you have any idea why there's such a reduction?
When a question similar to this was asked of the supervisor over those programs, one of the things that she suggested was the rental assistance program, and that perhaps the rental assistance program and at one point the extension of the unemployment benefits may have contributed to some of those statistics.
In what way?
The eligibility, people being eligible for services that maybe otherwise would have been eligible, with the increase, for example, in the unemployment benefits may have deemed some individuals not eligible for temporary assistance. And the expansion of the rental assistance program and having individuals being able to access that benefit may have discourage people from coming in and needing to apply for temporary assistance is kind of the explanation that she had shared.
Because I don't think the general public realizes that the number of people on what the public looks at as traditional welfare has actually declined over the past couple of years. And then even with the safety net individuals, a decline from 489 to 361 seems like quite a drop as well. And I would have thought that as the colder months come, that you wouldn't have seen that decline, that they're summer jobs, construction, a lot of those kinds of things, so it seems interesting that fewer people are turning to the county for what most of us consider traditional welfare programs at the moment.
There also may be some information in the employment unit to help support answering that question as well. I know that they've seen a lot of success in their employment program, may speak to these numbers as well.
A lot of success, or did you, what did you say?
I said there's been a lot of success in the employment.
Success.
Yes.
Well, I think, please pass on to them our commendations, because, if they're succeeding at helping people seek and gain employment, I think that's a great thing that's occurring out there.
Anyone else? Seeing none, thank you very much, Heather. Moving to community services and Jay.
Good evening. Thank you. So I've been asked to give you an update on the electronic health record. So we had our initial kickoff presentation at the beginning of September, which was actually probably about 3 months later than we anticipated going into this project. Some of that had to do with some contract glitches and things like that, and some negotiations. But in any event, that kickoff presentation was really, they came on site and they wanted information about our business process. So what that means is, number of clinics, types of clinics, number of ancillary programs, do they bill, do they not bill, do they need access, number of user licenses, things like that. So they got really a snapshot of the community services department. From there, they created what they call a beta shell. So, you can look at it as like a test program, but it's not really a test program because the beta program that they're building is actually eventually going to be our electronic platform, health record platform. So from September, they've been building this beta shell, based on our business process, number of clinics, number of clinicians, types of services, and so forth. So we've been having meetings with them since September, about twice a week. And what they were doing is they were kind of piecemealing it in a rather protracted process. Like taking one step at a time. Like one meeting might have been about adding our facilities and our locations and our insurances. And the next meeting might have been about program types and our procedures and visit types. So what we did was, in each of those, I guess, trainings or instructional sessions came with instructions. So we've been asking them to forward the instructions ahead of time so that when we meet, the task is already completed, or at least mostly completed, so we can get feedback at that time versus having to schedule a subsequent meeting with them if there was any issues or problems with what we were putting into the build of the beta. So, and that arose because they were looking at a May, June go live date. And, we've been pushing very hard to move that date forward. I told them all along, we're looking at the end of February, hopefully 1st of March. So, so we've been kind of working ahead of their schedule and trying to get them to let us move faster, because we have, individuals in our billing department that are able to do that. So one of the things that we have 75% completed is what they call visit types. And without getting into too much of the details, visit types are all the services that we provide. It could be a 15-minute crisis phone call. It could be a face-to-face crisis. It could be an initial assessment. It could be a health assessment, all the various service types that we provide. So we have 75% of those entered into the beta system. And once that is completed, then we should be able to test the entire system from patient scheduling to treatment to charges, charge creation, and then to the actual claim. So I can't say it's going as smoothly as I anticipated, but we are moving forward. We are getting some traction at this point, howbeit we did have a late start. If there's any questions on that. The next steps is actually putting in forms. And we use the NISCRI forms, which are pretty standard forms. They're New York State Clinical Records Initiative is what NISCRI stands for. Most of our forms are pretty standardized. We do have some specialized forms, but we can actually create those forms once we have a go live date. We can do it after the go live date. It doesn't have to be front loaded before we go live. If we wanted to tweak some of the state forms, which we have, particularly on the mental health side.
Any questions, any comments? Anything further, Jay?
I don't believe so. I have the updates.
Stand by just a minute. Mr. Burke has his hand up. Go ahead, John.
Related to this, I'm just wondering, Jay, if you've seen any trends as far as substance abuse or mental health, or greater need or greater incidence?
Well, there certainly is a greater need, I think, on both sides, both the mental health and the addiction side. You know, the trouble right now is it's that the workforce is so depleted that even programs that are trying to add on new staff or to expand and get into additional service provision really can't find adequate staff. I mean, if you were to go out on North Country Now, the employee site, you know, you got St. Lawrence Health System advertising, you have SLPC advertising, you have Citizen Advocates advertising, you have the Mohawk Reservation Clinics advertising, you have us advertising. So it's not for the lack of wanting to expand services. It's really, a lot of it comes down to the workforce shortage. And it's just, it seems like it's just not getting better. If anything, it's getting worse. We had an LCSWR, which, you know, John, is the highest level of social worker licensure you can have other than actually having a PhD, which really doesn't really help your clinical skills. That's more for research. So LCSWR is the highest level of social worker. And, you know, we had one and we were looking at her as possibly the supervising social worker. And then she had DSS experience, quite extensive DSS experience. So we had talked about her doing that co-location shared staff piece with DSS. And I got an email, so to speak, from her stating that she was offered a job with St. Lawrence Psychiatric Center for $85,500. You know, our base is next year, it'll be $61,192. I know that the Mohawk Reservation Clinic, they are trying to come close to matching the state, because the state is kind of leading the surge in this uptick of salary. So I know that they are, you know, trying to come close to matching that rate and also give a $5,000 sign-on bonus, which we kind of have difficulty doing, you know, in our government environment. I know, you know, CPH for an initial social worker, they're coming in around 73,000 right out of school, you know, and again, I mean, right now we're at 59,554, but next year we'll be at 61,192, but it's a little tough to compete for that with that. So, you know, and if you look on the second page, you know, our wait list is up to 6 to 7 for the mental health clinic. And actually, when this other person, you know, transfers to SLPC, pending her being credentialed and, you know, background clearance and things like that she has to go through to become a state worker, then, you know, that number might even get larger. So it's, you know, there is a lot of need, John. It's just the staffing. It's the shortage of staffing.
Thank you, Jay.
Thank you. Anyone else? Jay, I have a question for you regarding the billing, the very last graph. We seem to be hovering around that 90% success rate in having our bills paid. Is that a norm? I mean, I see according to the graphs that it is for that period of time, but statewide, how do we compare, if you know?
I don't really know statewide, Mr. Lightfoot. I do know that 90% when we contracted with IMA for the billing, that was their benchmark that they could get us to a 90% reimbursement rate. You know, whether or not that number will be able to go up once we have a new electronic record and feel comfortable taking back the billing, you know, I don't know. I'm hoping so. But we'll have to see.
And actually, that was at the bottom of my question, whether or not this electronic means would improve that end. And I guess your thought is possible.
Yeah, that's what we're hoping for, yes.
All right, thank you. Anyone else? Mr. Perkins.
Chairman. Jay, following up on Mr. Lightfoot's question, we're getting about 90% paid compared to billed. What's in that 10%? Is that Medicaid or just freebies?
Well, it could be. I mean, we do pretty good at trying. Well, we were doing fairly well at trying to match Medicare recipients with LCSWRs. Now that we're losing our LCSWR, unless they're duly insured and have like a Medicaid backup for secondary, that's going to be a hole that we're going to have to try to plug. But in terms of, some of these would probably be denials that were not worked in a timely manner. That would be part of it. It could have been that there was, and we've cracked down pretty good on this in terms of having the treatment plans done, because we have stops in our system that we do not bill for treatment plans, or we don't bill for services unless there's an intact treatment plan, because that would be subject to audit with OMIG if they come in here and we've billed for services that there's not an intact treatment plan that was acted during the time of that session being billed. But we're pretty much on top of that for the most part. We did a utilization review last week. We did find 2 individuals on the mental health side that had some outstanding treatment plans, and we're working on correcting that.
If we could, Jay, it'd be nice to see if you could track that 10% and see what the reasons are. If it's the billing that's, not done right, or whatever the circumstance. It'd be nice to know what that is so we could address that issue.
Right. All right. Well, I can reach out to IMA and see what their response would be to that.
Thank you.
IMA being our current electronic health record and biller.
Thank you.
Anyone else have a question or a comment?
I mean, I will say, looking at the numbers, the no-shows went down in the addiction side, but then they went back up on the mental health side. So pretty much came in fairly similar to last month, only 0.6% increase. I think this is actually one of our better months. I mean, I think total face-to-face across the board with all clinic counselors was 67.5. I mean, I didn't go back through the last, several years, but I think that's kind of at the top of where we've been, and I say that cautiously because things could change, next month, depending on no-show rates, cancellations, things like that. But in any event, this wasn't a bad month compared to, actually the previous month was 63.72, and now, or this month was 67.5. So I mean, I think we're trending upward ever so slightly, but it's, it's sometimes you take one step forward and then you take another step back as well. So, and then, losing another clinician, it's gonna sting. So.
Anyone else? Seeing that, if you're done, Jay, thank you very much.
All right, thank you.
And just to note that legislator Terminelli has been excused from tonight's meeting because of another commitment. We'll go now to the vacancy committee review.
So this month, we have 9 requests from 5 departments, of which you will see social services this evening as well. Oh, they're the only one on this agenda. And on the other agenda, you have IT, and I believe you have one other department. I did want to mention to you that our trend, if you look on your summary, we have returned to our more normal average pre-COVID. We had averaged between 155 and 165 pretty consistently since we started tracking in this form. And so as you see, we're at 164. That's about a 13.6 average per month. And so then to the right, the summary you see, I track monthly because, as you know, I provide you with the annual summary in August, and that's based on when the Vacancy Review Committee was put back into place. I track August to August, and that's the annual summary that you get. And just from September until this month, we continue to trend at 13.5. So we're right in that same spot that we had been before COVID. We dropped down in the 130s during 2019, 2020, but we've moved back into that average. Currently, out of our roughly 840 positions, we have 55 positions separate from the seasonal positions. We have 55 vacant. That's approximately 6.5% of our entire workforce, which I like to keep current, certainly for department heads, but also for the board. Did want to mention to you on the summary, some questions were raised on the highway position. That will come to you next week, but we're going to get some more information to you before we move that forward. But the social services positions are what's on for this evening, and Heather is back with us to address those. Heather?
So the first vacancy position is promotion. It's a clerk position, and staying in line with highlighting the reasons that the vacancies are being requested. The clerk is vacant because the individual took a promotion as a result of a retirement. So we're looking to fill the clerk position.
Questions on the clerk? Okay, next one, senior welfare examiner.
Yep. So again, this is a promotional position. The individual, we had an individual resign and move out of state. This senior social welfare examiner moved up into that position. So we're looking to backfill that position. And the only thing that I will add is there's been some substantial changes to the daycare state policies. So it's critical in looking at filling this position to replace that individual.
Questions on the TA SNAP position? Okay, support?
Yeah, so we have our child support enforcement supervisor is retiring, and this individual moved into his position. So we're looking to backfill the senior support investigator as a result of that promotion.
And I would just mention on this, if there's no questions, this has been one of the areas where we have an extremely long tenured supervisor who has been a tremendous asset to the department, who has, in this scenario that you've provided me with, the temporary positions, to transfer that knowledge, we were able to fill that position. Heather, what would you say, just over 3 weeks now?
Yes, that sounds about right. Mm-hmm.
So they have been able to work together and will until the departure date to transmit, to translate as much of the information in child support, which is a very complex unit, Not that any of them are not, but this one is particularly, it goes between states. It is a challenge. So this supervisor, we feel, will be well trained by the time that transition occurs. As things continue to change, as best we can prepare them to take over in these units, we believe that's important. So I thank you for giving the opportunity and the latitude beyond the COVID, which presented this opportunity, because this is really an area where they are very appreciative of the opportunity and it's working out very well. Any questions? Okay. The Secretary 1 position.
So this is actually a new position. We're looking at abolishing a keyboard specialist and creating a a Secretary 1 in the legal office. This will allow for greater flexibility in the assignment of workload and increased efficiencies in accordance with the family court regulations. And I see Mr. Button is on in case there's any additional information needed.
Thank you. Yes, the current position is actually a clerk position, keyboard specialist position. But the work that needs to be performed in there needs to transition to a Secretary 1, and to stay within the title and the permissions associated with the title. The request is to abolish the keyboard specialist position and convert it to a Secretary 1. That would enable additional assistance associated with the Article 10 matters. Those are the neglect and abuse matters that we're engaged in more. We're transitioning away from utilizing this individual as a child support a resource and into the neglect and abuse field.
Questions? Okay. Thank you, Steve. The other area I wanted just to mention briefly before Heather departs is a conversation that we had briefly, but we'll be returning to you probably next month or one of the following months once we gather more information. But there is a concern about oversight and supervision for Medicaid in social services. It is a situation where there was I believe it was medical services supervisor. And we are looking at that. We will be talking more with the vacancy committee. There are 3 units at least, but certainly with the Medicaid redesign team changes rolling out now already with a caution, they won't be implemented until April of next year. Certainly an area that we want to get right. So more will be coming to you on that, but we've heard from the staff. I'm gathering more information. It is a position that went away in more difficult fiscal times, but it's oversight that we believe we're going to look at more carefully and bring you information. Anything else, Heather?
No, thank you.
Okay, thank you.
Thank you, Heather.
Thank
Moving
you.
Moving along to committee reports, the Board of Health, Mr. Richards.
There is no meeting in December.
Community Development Program, Board of Directors, Mr. Sheriff.
Thank you, Mr. Chairman. Due to some medical issues, I was not at the attendance of the meeting that was held on December 8th, so I'll have an update for you at the next meeting.
Community Services Board, Ms. Curran.
Thank you, Mr. Chairman. We also took November off, so there was no meeting. I think we're going to reconvene after the first of the year.
Office for the Aging Advisory Board, Mr. Denisha.
We really not a lot to report, Mr. Chairman. I may have already mentioned this, but the home delivered meals that are provided by the Office for the Aging, they're up 40% from pre-COVID numbers. And the thing is, we know this is the season where the Office for the Aging is delivering holiday baskets to our home delivered meal clients. So my colleagues, if you haven't dipped into your wallet to reach into your pockets yet, for the Aging would certainly appreciate a donation. And you can give it to Ruth or Kelly, and they'll make sure that Andy gets it.
Ms. Terminelli is not with us this evening, so there will be no Youth Advisory Board report unless she's asked somebody else to present something. And I don't see where that's the case. Moving on, any old business? Any new business? Mr. Burke.
Just wondering, based on Jay's report, if we couldn't petition the governor to have a social work program in the North Country. SUNY Canton has a good nursing program, which, by the way, should be expanded. We need more nurses. Clarkson has done a great job with physical therapy, occupational therapy, and physician assistant. But we've been a federally designated shortage area for social workers for years. And, you know, with what happened at SUNY Potsdam, their enrollment is down. There's really no reason that we shouldn't have a master's in social work program within the 4 colleges. And I guess I'd like to suggest that we petition the governor to ask her to make this happen.
Mr. Forsythe.
Thank you, Mr. Chair. The American Recovery Act, the additional money we've received, the American Legion in Lisbon. I talked to one of the representatives earlier today. They're in kind of dire straits. The city of Augsburg has reached out to some of the nonprofit Salvation Army, I believe BFW, and donated some of their funds towards them, which has helped drastically. And I wonder, whoever's on this committee, if the American Legion can be considered. They're a stronghold in the town of Lisbon, and they need our help. So I'm just putting that out there, and I told them I'd put a plug in for them tonight. So thank you.
Mr. Reagan, or excuse me, Ms. Curran.
So I would agree with John that we lack the ability to turn out social workers. I know that in my part-time job, I find that. They did something interesting about 18 months ago where they allowed psychiatric nurse practitioners to have a certain part of their programming that was online, and that the clinical had to be obviously in person. Even if they don't want to give us something to allow us to have a program here, if they would allow an exemption for part of the didactic to be online, it would increase the number of people that could attend social work school. The biggest problem, I think, is similar to nursing. You lack not students, but educators. They want you to have a doctorate level or a PhD in order to teach these programs. And to do a master's, they want you to have a doctorate. So I think we probably, for at least a while, need to appeal to somebody to give us an exemption to be online in order to educate people. Thank you.
Thank you. Mr. Reagan.
Could we ask the county administrator to reach out to the 4 colleges to get one of them on board with the idea of offering this new discipline, but by pointing out that there are lots of employment opportunities available, and because, you know, the governor can't just wave a magic wand and make this happen. We need a college in the area that says, I will step up and take on this challenge, hire the staff who have the training to offer this program. And I think that's, you know, the first step that has to happen in order to make it happen. And then once we have one of the colleges saying, yes, I'm willing to do that, then we can, you know, go to the governor and the board of regents and everybody else to try to make it happen. But first, I believe we really need to get one of the colleges to agree to offer the program.
Would you be willing to make that contact?
Of course. Can I speak to that as well?
Yes, ma'am.
I remember that when President Esterberg was installed, probably 3 years ago, there was a conversation, an active conversation at that time, about a social work program, satellite, if you will, at SUNY Potsdam from Albany. I'm not sure where those fell out. Might have been the difficult budget times between then and now. I'm happy to follow up and certainly reach out to the other colleges.
Thank you.
You bet.
Mr. Akers?
To answer, Legislator Forsythe's question, the Committee for the American Rescue Funds is Reagan, myself, Dan Fay, and Tony Arquette. And I think everyone should be aware that every town has also already received monies from the American Rescue Plan. So I would appeal to, say, for example, the American Legion of Lisbon to actually appeal to the town board in Lisbon. They have received funds. I don't know the amount of money. I'm thinking that Madrid got a couple 100,000, for example. So the significant funds have been allocated to your communities that we all represent. But certainly we can look into that, Mr. Forsythe.
Thank you. Anyone else? Under new business? Seeing none, we have need for executive session, I assume,
Combined with operations.
with operations, and that will be handled at operations. If there's no further business, is there a motion to adjourn? By Mr. Smithers, second by Ms. Kern. All in favor?
Aye.
Opposed? Carried. We have an we don't need to do anything electronically.
I'll just take a couple minutes.
Calling the December Operations Committee meeting to order, please. May I have a motion to approve the agenda by Mr. Fay, seconded by Mr. Burr? All in favor?
Rita, we need to amend the agenda.
Yeah, oh, sorry.
Yep.
Pardon me. I have to first amend the agenda. Can I get a motion to amend the agenda to include the 6B broadband ad hoc committee update? And a resolution as, which is gonna be 6A on, that would be on your desk. So that's first motion by Mr. Taggart, seconded by Mr. Lightfoot. And now all those in favor, sorry, Kelly, I don't do
That's
this.
okay.
Aye. Any opposed? Okay. And secondly, I need the approval of the minutes for the November meeting.
Sorry, there's no minutes this month.
Oh,
We were down, our system was down, so I couldn't get to them.
Oh, so
Today
no
was the
to
first day up, so.
okay.
Yep.
Okay, so I can go right into resolutions?
Yes.
Yes, okay. So first we have Sheriff Bigword. Sheriff, right there. Thank you. So I have a resolution accepting a fiscal year 21 community-oriented policing services office or grant, office hiring program grant from the Department of Justice and modifying the 2022 budget for the Sheriff's Office, moved by Mr. Burke, seconded by Mr. Smithers. Sheriff, go ahead.
Thank you. Good evening, everybody. So this is a COPS grant that we applied for over this past summer. My administrative staff, along with our fiscal officer, did a great job of writing this grant. It was pretty extensive. I can say that we are only 1 out of 5 police departments in the whole state of New York that were awarded this grant. So my undersheriff and everybody else did a great job about applying, and it was quite extensive in how we wrote this grant. So what we want is to get a position in our drug task force, twofold. One is crime prevention, obviously, and the second is the community policing component of that. Obviously, I think everybody will tell you, or I know, that one of the biggest complaints I receive from the citizens of the county, either by phone or in person, is our epidemic with the illegal drugs, opiate, heroin, cocaine throughout the county. And part of my running for sheriff, one of my bullet points was to address this problem. And it's a threefold solution, in my opinion, is education, treatment, and enforcement. This grant would check 2 of the boxes of education and enforcement of that issue. We're pretty short-handed right now. We're down 6 openings or positions. So this would help us out by gaining this position. I'd put a seasoned veteran officer in this assignment. And again, they take care of any drug task force, education. We go out to the public, civic groups, elderly, municipalities. We do education about meth labs, how to recognize meth components, fentanyl, all those dangerous elements. So that person would be in charge of educating the public. The enforcement part would be the boots on the ground to get someone in the DTF to center on these illicit drugs. So I'm looking to have this grant approved. The county cost, I'm sure you're asking yourself, is it's a 4-year grant. Over the 4 years, it'd be $42,500 per year for the county. The last year of the grant, the 4th year, would be paid by asset forfeiture money out of my asset forfeiture fund. That would pay the entire 4th year benefits and salary. Any overtime incurred by this detective position would also be incurred by the asset forfeiture funds. So I'm looking to move this position.
Does anyone have any questions for the sheriff? Seeing none, all in favor?
Aye.
Any opposed? No. Next up, I have a resolution modifying the 2021 budget for the sheriff's office for overtime, moved by Mr. Denisha, seconded by Mr. Burke. Go ahead, Sheriff.
Okay, so obviously we've been a COVID issue here. I can tell you that in the jail, we have a pod, one of our bigger pods that's got some COVID issues in it. I've got 6 positive inmates and 5 COs that are out right now. That in part with the past COVID issues and people being in quarantine has created an overtime crisis in the jail and the road patrol. So we're looking to take some monies from funds that were not used in our jail budget and our criminal budget, and to pay for this overages and overtime.
Any questions for the sheriff? Mr. Forsythe. You had the beard like Mr. Changing strict for a second.
Thank you, Sheriff. How many inmates? What's the percentage vaccinated?
Inmates, I don't have that number. They are, when they come into the facility, we afford them that. I don't have the exact number. Some do take us up on that. Some don't. Some are there for short time. So it's the follow-up 30 days after is tough. The boosters are tough. I don't have an exact number, but I know our COs there's a significant number of COs that are vaccinated.
Okay, I'm just curious if there's a percentage of the inmates that are vaccinated.
I don't have that, but there are some.
No,
that
that's
have
fine.
taken the
No,
shot.
I have, no. Okay, thank you.
Yep.
Anyone else? Seeing none, all in favor? Any opposed? Carries. Next up, I have a resolution authorizing the chair to sign a federal equitable sharing program agreement and annual certification report for the sheriff's office for fiscal year 2021, moved by Mr. Burke, seconded by Mr. Smithers. Go ahead, Sheriff.
So this is we do this yearly. We have to get a resolution forward for an annual federal equitable sharing program agreement and our certification report. We have to have a resolution done every year to go forward with getting any of these funds.
Does anyone have any questions for the sheriff? Seeing none, all in favor?
Aye.
Any opposed? And then carries. I have a resolution authorizing the chair to sign contracts establishing a school resource officer SRO program for school districts in St. Lawrence County, moved by Mr. Denisha, seconded by Mr. Perkins. Go ahead, Sheriff.
Thank you. So we've been approached in the past, earlier in 2020, and I know I spoke about this a little bit, by schools in the past about having an SRO program. The COVID hit and it kind of was put on the back burner. It's now back in the forefront. I've had 3 schools approach me and requiring or asking for an SRO in their schools. So I've talked to a few of these schools and I'm looking for them to pay the salary, the benefits, overtime costs and training. And I'm looking for a 4 to 5 year commitment from each school for this position. What we're looking for is getting a certification for whatever officer we pick. Obviously, we continue training. It's done through municipal police department training council. There's a basic SRO school that everybody has to go through. And then there's an additional trainings, de-escalation, students with disabilities, safety conference divisions, and that's continual training. Obviously, any officer we do put in the schools would have would be a veteran, high standard qualities, and performance evaluations will be done periodically. So we're looking to put a position in the academy so we can backfill to this position. And obviously, you've got to do this fast because the academy starts January 10th. In this contract that we're trying to get with the schools, they would be in the school for 10-month period, the school's in session, and then the officer would come back and work the road in the months of July and August and be able to help out with patrols, boat patrol, UTV operations on the trail systems, things of that sort. I know there was a question about vehicle use, and from one of the legislators, we have some older vehicles that we take offline. We could use one of those vehicles, so there will be no additional vehicles purchased or any new vehicles that would need for this program. The primary function of the SRO, obviously, is to protect the student, staff, in the school from any threats of violence. We all know about what happened in Michigan just a short time ago in Oakland County. And as I spoke to you guys last time, there's an SRO in that school that was instrumental in relating information to the other officers that were coming to the scene, and then obviously being able to handle that situation as they arrived. Pretty important component in safety of school. Positive relationship with the students is another reason I think an SRO program needs to put in there. Working with the school districts on their safety committees. There's a plethora of information and reasons why we should have them in the school, and I wholeheartedly support this. Other than that, I take any questions.
First was Mr. Smithers.
I think I heard you say that you were looking for the school to pay the cost of salary and the training, and as far as the vehicle involved cost, you said that would be negligible. Do you see what cost do you see to be paid for or funded by the county?
The uniforms that, and any equipment that's related to uniforms, the body cam that they would be wearing at the school. So very minimal cost for us at the county. But don't forget, we're also getting those patrols back in the month of July and August to work for us, where the salaries and benefits being paid by the school districts.
Mr. Reagan was next.
Sure, I think it's a wonderful idea. Is there any way to get the school districts to sign a contract to do it for us to support these the position for whatever period of time we're talking about?
Right, so we're working with the schools right now on contracts. We've already worked on policy and procedures. That's already been pretty much completed with my undersheriff doing the Lowman's work on that. But that's pretty much completed. We are working on the contracts. We've been working on it for about the last 2 weeks. That's on my desk for review. And going forward, the schools would have to be committed for 4 to 5 years, and their commitment would definitely have to be the salary, benefits, and the training costs. That's the bottom line.
The reason I asked the question is, over the years, I've seen a lot of school districts, a lot of school boards get all excited about school resource officers. Everyone gets all excited. The effort is made, the officers are hired. And then there's a tight budget year, and the school districts, that seems to be the first thing that goes is the school resource officer. And, you know, as we both know, the need doesn't go away. And I just, you know, feel it's important that the school districts make an ironclad commitment that, you know, school day comes and goes, but these positions should remain a priority.
Right. So any contract we would have with the schools would be reviewed by the county attorney. And I hope he would know how to institute that contract.
Thank you.
Okay, next up is Mr. Lopez.
Good evening, Sheriff Phil Lightfoot. Has any part of a potential contract been put together that relates to either side being able to vacate the agreement with notice?
No.
Is there going to be such a article in any agreement?
No.
So what happens if the school comes to you and says, we can't afford this anymore on December of 2024, and we're gonna have to let your guy go at the end of the year? How are you going to handle that?
Well, that's where the contract comes in. I guess the school district would have to fulfill the contract. That's something they're gonna have to discuss with me. If they can't make that happen, then I won't commit.
All right. Once you, if I may, Once you have the framework for a contract, or the county attorney draws it up, will you make that available to, one of the committees, to this committee? So that we
Absolutely.
can,
Absolutely.
okay, thank you, thank you.
Mr. Denisha.
Thank you, Madam Chair. I just want to say how much I appreciate this, Sheriff. I know we talked about school resource officer, I think a couple of years ago, maybe longer. My youngest brother is a school resource officer works for the Marion County Sheriff's Department in Florida. He's a retired New York State trooper. And he loves the job. And it's great that they're there because we've seen instances, Florida, Colorado, Michigan, Connecticut, Texas. But not only there for the safety of the students, but the students have an opportunity to see law enforcement in a different light. And I know that's one thing my brother said has been the best part of his job is actually a lot of the kids that you come in contact with have no role models. And they don't look at law enforcement. Law enforcement is a bad thing, but it gives them an opportunity to reach some of these kids that normally they wouldn't be able to be reached. But I think there's there's certainly a social value as well.
Anyone else? Mr. Forsythe.
Thank you, Madam Chair. Sheriff, how many school districts do you believe would utilize this?
So I had a meeting with all the superintendents a couple weeks ago at their annual monthly meeting. I know 3 are trying to get it this year. 3 others have approached me about not this year because it's such a time frame to get it together because we got to get someone in the academy backfill. But there was 3 other schools that showed interest in the future that were going to look into this.
And how many school districts are there in the county? At least 16, right?
18, 16, 18.
17.
18.
There's 17,
17 in Harrisville.
17 is here.
including Harrisville. Has there been any thought given with the notice that Ogdensburg is going to close? Retired correction officers or people that have lost their job or don't want to transfer, they have peace officer status. Would there be any utilization of them, especially since it's a 10-month contract instead of 12? Any thought to that? Or?
It had to be a police officer, not a peace officer. So there's 2 different.
It does have to be a police officer.
It does.
Okay.
That being said, I've had 2 inquiries from state COs that were looking to transfer to our correctional facility. And we're looking into if that's, if that's possible. And they do have a couple openings. So more than glad to clear that if it can happen.
My thought is, this is a great idea. And I know schools are flush with money, but they won't be for long, more than likely. And I think it's going to be down the road. It's going to be a nightmare, but I'll listen to whatever conversations take place, I guess. So
I appreciate that.
Thank you.
Anyone else have a question? Mr. Ayers?
But just a comment, these will be senior officers that will actually be involved in these schools. And so as people retire, we'll have trained staff on board. And so I think in the summertime, I think it's from a management standpoint for public safety, these individuals will be there for the summertime and other holiday times and things of that nature. So it's kind of like, I won't say it's a farm team because the farm team will still be here, but they'll have those senior, and that's what we want. Those individuals will be required to be armed, will they not, Sheriff?
Yes.
Okay. And if a school district says that we don't want an armed police officer in their school, you have the right to refuse that service.
That is correct.
Okay, thank you very much.
Anybody else? Seeing none, all in favor?
Aye.
Aye.
Any opposed? None, motion carries. Thank you, Sheriff. Does
Thank
anyone
you.
else have any questions? And if we don't see you, Merry Christmas.
You'll see him on vacancy.
Oh, well, okay, all right, sure. Next up, Mr. Pfotenhauer, we have a resolution authorizing the chair to sign a contract with Volunteer Transport Center, Inc. for first mile, last mile, moved by Mr. Burke, seconded by Mr. Smithers. Go right ahead.
Thank you. Good evening, all. This resolution authorizes the signing of a contract with an entity that we've worked with for some time now, the Volunteer Transportation Center. They have been instrumental in providing a number of transportation services to us. This resolution specifically speaks to the First Mile, Last Mile program, which is it's a volunteer driver-based program that will take individuals to transit stops to get them from their place of residence to a transit stop, so they can use the bus system. I did go out to an RFP, or went through an RFP process, and VTC, or Volunteer Transportation Center, was the only vendor that applied, and so we look to continue our relationship with them, and look for this resolution to authorize the signing of the contract.
Any questions, Mr. Reagan?
Jason, how are we doing with the first mile, last mile program?
How are we doing? I think it's going quite well. Yeah, I don't have numbers right off the top here, but I can get you some information on trips, daily trips, if that's your pleasure.
And the bus transportation system, how's it doing in terms of ridership?
Good. It's not quite to pre-COVID rates, our ridership numbers, but the numbers are quite good. There are some challenges with some routes. Always, some routes are less utilized than others, but overall, it's operating at I think it's providing an excellent service to those individuals that do ride it on a regular basis.
Can you explain what the first mile, last mile program is?
Sure. So First Mile, Last Mile is a program through the VTC, Volunteer Transportation Service, that will respond to individuals who call up to VTC to request transportation from their place of residence to a bus stop, so they can basically get out of the car and get onto a bus that will take them to other points in their that they're looking to travel to during their day.
Because I think a lot of people in the county still are not aware that this program exists, and that they can get transportation all over this county. All they've got to do is call, and you know, it's a novel program and a novel approach, but you have people, especially people who live in rural areas, who are saying, oh, you know, I live far from a bus stop, I can't, you know, go to make use of this bus system that's running around the county, and actually they can.
Yes, we always look. I'm sorry. I was just going to say that we always look for opportunities wherever we can to promote this, and we'll continue to do so, and look to promote it even more so.
Thank you.
Anybody else have any questions? Okay. All in favor?
Aye.
Any opposed? Here. Next up, we have a resolution authorizing the chair to sign a one-year contract extension with Volunteer Transportation Center, Inc. for transport services to COVID-19 vaccine sites, moved by Mr. Burke, seconded by Mr. Smithers. Go ahead.
Thank you. Again, same entity, VTC, currently under contract to provide these services to individuals that are trying to get to a vaccination site and don't have the transportation to do so. So we have a contract to provide for this service. In 2021 to date, we've transported 194 individuals to a vaccination site for vaccination purposes, and this will allow this program to continue into 2022.
Thank you. Any questions for Mr. Coleman? Seeing none, all in favor?
Aye.
Any opposed? Carries.
Thank you.
Very much. Sorry, Mr. Fay.
Could I ask Jason if he could make the report for me in the planning board, because I had to excuse myself Thursday?
Can
You
you
be
stay on
available,
to
Jason?
make that? Okay.
Happy to do that. Yep. Thank you.
Okay. Next up, we have Jen Dorothy. I have a resolution authorizing the chair to sign a contract with OptiMed Health Partners for infusion therapy services, moved by Mr. Lightfoot, seconded by Mr. Perkins.
Hi, good evening. So the Healthcare Committee met on November 16th. Our benefit advisor, Burnham, coordinated a presentation by a company called OptiMed Health Partners. OptiMed offers the program that includes identifying prescription medications that are used to treat complex medical conditions involving infusion medications and setting up services to administer the medications at home or at a mutually agreed upon facility. There are no minimum utilization requirements and no monthly fees, as OptiMed bills their fees into the services and the medication provided, which can be secured at a lower cost than currently provided through medical providers and in a medical facility or office setting. 12 months of recent claims data revealed that 12 infusion therapy medications, which represents 20 members, had a potential approximate savings for St. Lawrence County of over $1 million. The program will entail flagging healthcare claims that meet predetermined criteria established by OptiMed, contacting members, and contacting prescribing physicians to set up the services and communicate ongoing medical care. Because the program will be voluntary for plan members, St. Lawrence County will provide participating members with incentives to utilize this program service, which may be phased in over a period of time in a manner that Healthcare Committee deems appropriate to increase participation rates. And besides the incentive of being able to have the services provided in one's own home, the incentives might include waiving cost shares for members and gift cards.
Okay, does anyone have any questions? Margaret?
Thank you. Mrs. Dorothy, did you say that most of the time those medications are done like in a practice office or something like that? Did you say they would be given in the home?
Yes, this company.
Okay.
Yep, this company specializes into going into members' homes when possible.
Thank you.
Anyone else have any questions?
Forsythe.
Sorry, Mr. Forsythe.
Thank you, Madam Chair. I'd encourage everyone to support this resolution. If we can even get half the people, the high claim people, to switch over to this, it'll be amazing what it saves. And really, there's no explanation for where that additional money goes, over $1 million. I don't know if it's the hospitals, the provider, who, but if we can get people on this plan to participate, it'll be huge for us. So I hope the word gets out, and I hope we really do our best to advertise this, because it'll be a big move for the county's health plan for sure. Thank you.
Next up is Mr. Lightfoot.
Just as a point of information, in case anybody hasn't looked into it, almost all of these drugs that are administered by way of infusion are cancer drugs. So most of these people are cancer patients, and it's very important to them. So I hope that this goes through and that we are able to avail ourselves of it for their convenience as well as saving money for the county.
Okay, does anyone else have any questions? I have one, if I may. Are they going to get into the monoclonal antibodies at all? Because you can now write an order when people are COVID positive and have people go to a local ER to get the monoclonal antibodies. It would be nice if this was something that might come with one of these companies where you could just have them delivered to someone's house. You would cut down on exposures and you would cut down on the fees of people going to the ER. I know that's probably a wild card for you, Johnny and Tori. Just a thought.
Well, is it an infusion medication?
Yes.
Oh, I can certainly look into that. They didn't mention specifics, but I think all infusion medications and therapies were part of this.
Anyone else? All in favor?
Aye.
Any opposed? Carried. Next up, I have a resolution, adoption of a revised Family and Medical Leave Act policy for St. Lawrence County, moved by Mr. Akers, seconded by Mr. Smithers. Go right ahead.
Hi, so in 1993, the Family Medical and Leave Act was passed. And over the years, it has evolved a lot. The last time I think our policy was updated, it was in around 2016. So I'm looking to revise and update our FMLA policy to reflect the changes over the years. So this policy, the policy will be updated to include the following changes. So FMLA will be used to start when all benefits. It used to say that FMLA would start when all benefits were exhausted. Now it starts when the employee goes out on leave, and that's the law. We can't really wait until the benefits are exhausted. The FMLA used to run concurrently with extended sick leave, and now we would start it when the employee first goes out on leave. Again, this is the law until extended sick leave starts. It will run concurrently with paid benefit time. We took out any references to central services and personnel office and changed it to human resources. We addressed the intermittent leave for bonding reasons. This will now be continuous leave and not intermittent. We added military leave provisions, which just weren't in there at all. There's several different military leave provisions. We addressed the law that states that married employees, that both married parties, if they work at St. Lawrence County, they get 12 weeks off total for birth and placement of child care of the employee parents. And that's the law as well. And those are the changes in the FMLA policy.
Any questions? Questions, Brandon? Seeing none, all in favor?
Aye.
Any opposed? Carries. Thank you, Johnny,
You're welcome.
and Merry Christmas. We don't see you. Next up, I'm trying to get there. Mr. Denisha has a resolution. Did you want to read it?
Yes, I would like to thank you. I'd like to offer a resolution proclaiming recognition of the 100th birthday of Mrs. Agnes Emma Landon Woodrow.
Moved by Mr. Akers, seconded by Lightfoot, and Mr. Taggart, and Mr. Fay, and Mr. Burris. Looks like everybody, myself included. Did you want to speak to it?
Thank you. I really appreciate that. Aggie, well, her name is Agnes, but everyone knows her as Aggie. And Aggie is a great lady. And it was this is very fitting. She's done a lot in the community over the years. You know, and I don't think there's anyone that lives in Herman, Russell, or Caliber that doesn't know package. Actually going to have her a celebration of her birthday on January 8th, which is a Saturday. It's going to be from 1 to 3 in the at the Herman Volunteer Fire Department. And hopefully we'll still be able to do it, you know, the COVID rules and regulations, but that's the plan is to, and I will be presenting the resolution.
All in favor, or if anyone else wanted to say anything? Seeing none, all in favor?
Aye.
Any opposed? None carried. Thank you. Okay, next up. Legislator Margaret Hasford. Do you want to read your resolution? Or do you want me to? Have you?
Go ahead. I
Okay.
will comment on it.
I have a resolution supporting the expansion of broadband infrastructure in St. Lawrence County, moved by Mr. Akers, seconded by Mr. Smithers and Tanisha. Go right ahead, Mrs. Hammond.
Thank you, Ms. Curran. This was at the suggestion of legislator Terminelli that I offer this resolution. She had this idea in one of our committee meetings. I think it's a great idea. We recently passed a resolution supporting the expansion of broadband, but this speaks more specifically to our particular county and the areas affected by the lack of broadband. It's critical that we support this effort because to grow and provide services for our constituents, they need good broadband. And I'd ask that my colleagues support this and thank legislator Terminelli for suggesting it. She wanted to be added as a co-sponsor. She asked me to do that, but I didn't know if I could do that just without.
Yes, we can.
Thank you.
Okay. So noted. Anyone have any questions about this? Ms. Bianco?
I would also like to be added as a co-sponsor, please.
Okay. We'll add Ms. Bianco. Mr. Burke would like to be added. Mr. Perkins?
Thank you, Madam Chair. I think this is a good idea. I have a large area, very rural. I have a lot of people complaining they have no broadband. They actually have very poor phone connections with the copper line. And it's not just a matter of businesses thriving or people getting their schoolwork. It's in case of emergencies. And I think it's very important to do that. And I'm not one for studies because usually we do the studies and they go nowhere. We spend a lot of money on it. So I really hope this committee can get grants, can find solutions to improve on the broadband and potentially the copper phone lines we have now. It's extremely important for our rural communities for the help with our really emergencies and elderly. Thank you.
Anyone else want to speak to this? Oh, Mr. Arquette?
Thank you, Ms. Chairman. You know, I travel to Route 11 to go to Canton regularly for the meetings, and US Route 11 in the little hamlet of Sanfordville, you're dropping calls every time that you go through there. I mean, I know we're in a sparse region, as Mr. Perkins put it, but up in his region, I'm up there a lot, and on Route 72, another major fairway, and again, the little reception. So I fully support this resolution, and I think we're long overdue in keeping up with some of our neighboring regions as far as broadband's concerned. Fully support it.
Anyone else? Seeing none, all in favor?
Aye.
Any opposed? No. Resolution carried. Next up, Mrs. Haggard is going to give us a little committee report.
Yes,
Or
thank
maybe
you.
a big committee report. Thank you.
Well, Dylan helped me to make me look good by doing some slides for you tonight. And I want to thank Legislator Reagan for suggesting we have this committee, and our chairperson, or chairman, Mr. Sheridan, for asking us to do this. You can see the screen, so the next slide, please, Melanie. This is thank you, Dana. This is a list of the people that are involved, and we've had several meetings so far. We've been meeting every 2 weeks. These are the people that know what's going on. Maybe Suzanne and Nicole do too. I don't want to include them in it, but this is really the people that know how to get this done and are advising us. We are so fortunate to have these resources and these people, and particularly our own planning department have been very instrumental in getting this going. Next slide, please. In the northern 2/3 of the county, there are several pockets of rural areas which are limited to Usenet as their only broadband option. These pockets of limited access could be found in the towns of Brazier, Stockholm, Norfolk, Canton, Louisville, Hopkinton, Parishville, DeKalb, Oswegatchie, Morristown, Pitcairn. The rural areas in the southern and eastern section of the county, specifically in the towns of Pitcairn, Fine, Clare, Clifton, Colton, Parishville, Hopkinton, and Piercefield, are also limited. This gives you a little overview of that study that you referred to, Rick, has great information in it. And this tells you who responded and the number of people that have no access. We also have great maps to show you tonight that delineate the first steps of where we should focus our energy. Okay, this is a map of the existing broadband. And when you look at it, you think, oh, that's great. But you can see right along that Route 11 line, there's plenty of broadband, and up by the river, here and there, they don't have it. But there's a lot of county in between. And the study that was done, along with other resources, have named the areas that are in the most need. And it's amazing how little coverage there are. And we'll get into that in the next slide. Thank you. The red dots are for people that responded that don't have the ability to purchase internet for their needs. So they can't even go out and get internet. And you can see the two clusters of the red dots line up perfectly with those areas identified as areas of, it's called socially vulnerable communities. They're cut off in a lot of ways for telehealth emergencies, as Rick mentioned. And could you go to the next slide, please? Those areas right there. So this map shows the census blocks identified by ECC, which is a company that Dank and we partnered with to get that study done for broadband expansion and grant funding. And grants, and the people in planning can explain this so much better than I can. But identifying these areas, some of the areas result in extra points on grants. So we're more likely to get those because of economic indicators, and need will make it more of an area that would be funded. The term frontier and remote is used here to describe territory characterized by some combination of low population size and high geographic remoteness. Next slide, please. Okay, there are lots of grant opportunities right now. You're probably familiar with the USDA Rural Development Broadband Reconnect program. The deadline for applying for that is February 22nd. So I'm not sure that we'll be there, but the people in the planning office know what they're doing. They're going to help us get there. Most grants require 25% local match. That does not necessarily mean that the county would contribute that, but it could be in part incentivizing the ISPs. If they were to apply for the grant, get the grant, we would incentivize by paying a portion of that 25% that they'd be required to pay. The northern border, this USDA is called Reconnect, and that's the one you hear a lot about. There's about $2 billion in money out there right now for broadband. The Northern Border Regional Commission has grants, National Telecommunications and Information Administration, and the New York State Broadband Office. And there are a lot of counties right now, particularly in our area, that are doing what we are trying to do with broadband. Some of them have a jump on us in terms of getting this going, but it may help us lobbying the state for incentives, either tax incentives for ISPs or whatever is required. I asked Jason to hang around so that he could, next slide, please. It's very nice of him, help me with these maps. And I'm going to ask him to explain these two. By the way, they put together specific overlays for this presentation, and I want to thank them for doing that. So if Jason is here, or can see the screen,
Yep.
can he?
Yes, I can. Yep.
Thank you.
Thank you very much, Legislator Haggard. Yeah, touched on everything I would have touched on in your presentation. I can just talk quickly to the two images that you see up on the screen now. The one on the left identified as Canton, and on the right is Colton. These are the two areas. First of all, these maps were produced by ECC. They came out of that study that ECC and or that the county and DANC asked ECC to produce. And if you look at the one on the left, the Canton map, and if you look over to the western side where it says Rensselaer Falls, underneath the falls, you can see, thanks Dylan, you can see those highlighted areas. Those are our census blocks. And those are areas that ECC identified as being underserved, significantly underserved. And the previous map that was up also showed these areas, but not in this much detail. This is a nice map because it shows the area in question, and it also shows the other the fiber network that exists right now. So all those squiggly lines on there that mostly follow road lines or the road pattern are fiber, existing fiber or coax that exists now to provide broadband. You see in that area of Canton, there's a clear lack of those lines on some of the Irish Settlement Road is a main road there. The Old DeKalb Road, quite heavily populated, not any high-speed fiber along those roads. If you come over to the other map, Colton, you can see, thanks Dylan, right to the south of the hamlet of Colton, down 56, you have South Colton. Again, you see those highlighted census blocks identified as high population areas, underserved. And these areas also correspond with what we saw previously on the map that showed the areas that will receive additional points in scoring because of their rural nature or their the FAR was one, I believe, and maybe Dylan, if you could go back to the previous map, maybe two maps up. There, that one right there. Thank you. Yeah, the FAR, the frontier and remote areas. The pink between Pierpont and Hopkinton, that's that Colton area we were just looking at, and then over just to the west of Canton, you see those blocks in the socially vulnerable community area. Again, those are the areas that identified in the USDA Reconnect application as being more competitive. They would garner more points for providing broadband in those areas. So does happy to speak more to that if anyone has any particular questions about the maps.
But one thing I did want to say, thank you, Jason, very much.
Thank you.
This is the beginning. These are the most needy areas. We wouldn't want anybody in the county to get upset that we're not looking at every area, but we tried to go to the area identified by the ECC study as the most needed for right now and where we could get funding for broadband. Are there any questions? I could try to answer them, or Jason, don't go anywhere. No.
Mr. Burke has one.
Yes.
Just wondering, Margaret, what's the next step?
Thank you for asking that. Well, we have to engage the ISPs, being primarily Spectrum, Slick, and hold on a minute, I can't think of the third. Vios, which is Verizon. And we're going back and forth about how to do that exactly. There are some people within the county and DANK and IDA who have connections with the ISPs who can get that started. But also, it's very competitive right now because of the other counties being in the same position we're in, receiving funding from grants plus the ARPA money if that becomes available for part of the match. We're hoping to incentivize somehow that the ISPs will be interested in St. Lawrence County over some of the other ones that are also applying for the same sort of thing. So right now we're sort of at a standstill until we can get some sort of interest from the internet service providers as to whether they want to participate. And some of these grants, they are the applicants. We are not, but we would, contribute data for their application that would help us too. So we're having a meeting Wednesday. Anyone's always welcome to attend if they'd like to. Can you speak to Dylan a little bit about the what we discussed this afternoon in terms of asking for interest and how we go about that?
Certainly. So we're looking at different ways in which we can engage the ISPs and how we can generate the most amount of interest for them. So one thing we're looking at is potentially putting out a competitive process or a statement of interest, perhaps. It could take a number of forms. Maybe we identify some of these tracks, and ask them for a certain proposal on, what kind of skin they're willing to put into the game, and just kind of see what the level of interest is out there for expanding into some of these areas.
Mr. Reagan, you have a question?
Just a comment. Margaret, I think everybody on the board appreciates your hard work on this, and your committees and the people that staff who've been working on this. During the initial discussions of the American Rescue Plan Committee, there seems to be a lot of interest in coming up with some money to help make this actually happen. And that has yet to be worked out in detail. But in broad strokes, I think that one of the recommendations with the American Rescue Plan Act was to encourage broadband investment. And that's something that Chairman Akers, Chairman Sheridan, Legislator Arquette, myself, and who am I missing? And Legislator Fay have considered as a major priority. And there's some thought that the infrastructure bill will have additional money made available for broadband investment. So, our thought was, since the rescue plan money has to be spent over a 3-year period, that we break whatever money we do set aside for broadband to use it over a 3-year period, so that if better programs become available that can reach more people than the traditional ones that everyone has, got used to, that we have local match money that can be put into this, so that instead of just putting money into 2 towns, that we can reach more people in more of the rural towns across the county. And I think, everybody on the board is wants to see real action happen on expanding broadband access into as many rural areas as we can.
Thank you. Anyone else? Mr. Perkins?
Thank you, Madam Chair. I'd like to echo Mr. Aiken. I think what you're doing is a great thing. I know we've had meetings a few years ago with some providers. I guess I'm wondering, do you have specific goals that you're trying to meet? You have defined objectives, how many people, 50%, 70%, what we're trying to take care of. And I know in some of the presentations we've had before, some of these providers get the grants to do so much work, put so many people on, go down the polls and do certain numbers, but they did not do their quotas and paid the fine instead because it was cheaper. Are we looking at that at all, or keeping that in mind? Because I hate to see them get the grants and just pay the fine afterwards and not put up the broadband that they're supposed to. Just something for thought.
Thank you for bringing that up. I'm not familiar with that, and that would certainly be something probably Jason could speak to, but I'm sure he's still here. He's right there. Okay, great.
I can tell you as much as I know about what I think you're referring to, Mr. Perkins. I know the Legislator Perkins. I know that one provider was required to meet a certain number of additional installations as part of a settlement agreement. We've had conversations with that provider, Charter or Spectrum is that provider, and they have identified that they have met their requirements. Now, that's something that certainly that we can look into and ensure that those have been met. But at face value now, the reference or the discussions that we have had with them is that they have met what they were required to do. Now, in terms of not doing it and paying fines, I'm not familiar with other providers or specifically what those areas look like.
One thing I did want to point out was that this is going to take a while and it's going to be a rollout. I have a problem with patience. I'd like to have this happen overnight, of course, but it will take a while, and we're going to identify by need those areas in the county by prioritizing them. But unfortunately, it's going to be an effort of many entities, including us and possibly the state, because of taxing that they put on. And I believe Representative Stefanik had come up with a proposal to ask New York State not to have this tax on infrastructure, which hasn't been charged, by the way, since it's been instituted, but it is a law there. So this is going to involve a lot. It's a big one. It's a big project, but thank you very much.
We're all set? Okay, thank you very much, Mrs. Hager.
Certainly.
I have one more resolution opposing the adoption of the New York Wage Board recommendations for decreasing the overtime threshold for farm workers from 60 hours to 40 hours per week. Can I get a, Mr. Akers will move that, second by Mr. Denisha. I guess Mr. Akers, want to speak to it?
Yes, I would. I'd like to be added as a co-sponsor. New York farmers are under really incredible stress right now, particularly the dairy industry. Getting workers, keeping workers, just even finding workers, and then with the COVID, much of the population is young. Many of them have chosen not to be vaccinated, and their family members are being quarantined because their kids are in school and they came in contact with somebody. But the reality is, the reason that it's really been detrimental also is because of COVID, because of the restrictions placed on COVID, that 40% of the dairy is actually used in the restaurants, and COVID has killed the restaurant business. It's coming back, and now we have more restrictions in place. So you have this abundance of product, and you just can't turn a cow off from milking overnight and decrease your numbers. You're going to see in your fruits, in your vegetables, it may be unlikely that these migrant workers from the islands that come up and they travel with the vegetables and the fruit as they become ripe from Florida up through, it's unlikely that they will come to New York because they work seasonally and then they go back home. And so for the 6 months that they're here in the United States, they want to work as many hours as they can. And so they're not going to come to New York to work a 40-hour week. And the person that's growing the crops, the apples, the peaches, strawberries, whatever, the margins are so low in commodities, and particularly in the ag commodities, they aren't going to be able to afford time and a half from the 60 hours. So it's very likely that you won't have anybody coming to Western New York to pick your fruits, your peaches, and New York will be facing a shortage. We will be importing product from other states and actually other countries. Blueberries from Chile that we're getting here now seasonally, they aren't going to be produced. And it's a really, on the wage board, we had our representative, New York Farm Bureau, Dave Fisher from Madrid, on that board, but the board itself this wage board ruled in favor of going to a 40-hour week. It will be devastating. The dairy farmers are under quotas right now, like an informal quota system, because there's so much product that they overproduce, they are penalized. They've been asked to take a 5% reduction from what they have, and they're also going to be starting in January, assess 35 cents per hundredweight. One of the co-ops is for every hundredweight that they produce. And with everything that's also the commodities under purchase, then if you've been reading in the media about the price of fertilizer, is going to be skyrocketing, seeds themselves, all your inputs for farming are going to be up. It's buying retail and selling wholesale is the nature of ag, and this time it's worse. And here in New York State, truly, if this passes, it will devastate here in St. Lawrence County as well as the rest of New York State.
I think one place I saw a little sticker that said, no farms, no food, no jokes. Anybody else? Seeing none, all in favor?
Aye.
Any opposed? Yes.
Madam Chair, if it's okay, we'll do vacancy first.
Sure.
We have two departments. The sheriff is still with us, I believe, and IT for this committee agenda. Sheriff?
Yes. I had a recent resignation in the correctional facility from a CO. Our minimum staffing level is 56. This will bring us down to 55. So I'm looking to fill this position to get us back up to the 56 minimum mandated staffing set by New York State Commission.
Questions on the correction officer? Okay.
Jail count maybe?
Jail count, Sheriff?
114.
Pretty standard, up over 110 to 130. Seems to stay pretty consistent lately. And thank you, Sheriff.
Thank you.
And next up, we have IT. Rick Johnson is with us.
Good evening, everybody. I've got the result of the domino effect here. So I moved to director. You had already approved the manager position. I filled that with one of my staff, Rodney Cisneros, who incidentally is doing a great job at it. He had been sitting at the microcomputer systems coordinator position, which vacated that. So what I've done is moved Lucas Day, who is my computer tech, over. I'm looking to do that, move him over to the coordinator position, vacating the tech, which I then need to fill. So it's a kind of a game of dominoes moving forward, but that's why I have these two positions, which I'd like to fill immediately.
Okay. Oh,
Questions?
questions? I see none.
Okay.
Next up is the county
Let's do both.
administrator. I'm sorry?
Did he do both?
Oh, we can vote on.
No, I said, did he
Yes.
cover both? Okay.
Yeah.
Thank you, Rick.
Thank you.
Yes. I have a few items. Under the county administrator's report tonight, just a brief COVID update. For those of you who may not seen it, over the weekend up until through today, 207, that was 102 on Saturday, 35 Sunday, and 70 today. Just to keep you updated, there has been an increase in testing. And we were also provided our update from Public Health this morning. The first dose, we are now at a total countywide of 61.1%. And for full vaccination totals, we're at 57.4%. Tomorrow, we actually will return to a practice. The St. Lawrence County was one of the first counties to visit the farms and provide vaccination options for our migrant workers. So they will be returning tomorrow. They have 80 boosters scheduled and an additional 20 first doses. So they also found when they went the first time, some folks who weren't registered went ahead and got it once they were on site. So the farms have assisted this time a little bit more. We will take UCV to a consolidation of locations rather than hit 20 locations, which I think will make it much easier for our staff. So we're looking forward to having those boosters out and in conjunction with Cornell Cooperative Extension as well with the translators will be joining us. Pfizer clinics will continue at Public Health on Mondays. They may be adjusting the hours, so we'll get that information out to you. And in January, the hope is with staffing levels maintained that the community pods will once again be held. And if you recall, those were held in Ogdensburg at OFA. They were held in Star Lake at the fire department and in Governor and Messina community centers. So they will try to make another round of community pods to make vaccinations available. Any questions on COVID now? We do have a COVID leaders call tomorrow with NISAC. As I mentioned to you last time, we are meeting on the conference call every Friday now as a type of control room, but fewer participants. The hospitals now are convening weekly as well. And the reopening task force will be convening. If you assisted with that the last time, check your email. With the changes in the governor's mandate, we'll be convening that group to have a conversation on Wednesday morning to assist businesses with making adjustments necessary to adhere to the mandate. We are currently sorting through our enforcement strategies, but also just want to make the board aware that the reopening task force will make an effort to assist businesses. Any questions on COVID before I move on?
Mr. Burke.
Any additional resources coming from the state route?
They are not yet, but we are asking with more frequency. So it's my understanding that Clinton County will be receiving some assistance with their vaccinations. I'll confirm that. And I believe Jefferson County is seeing some additional testing resources. So I will let you know what I find out.
Mr. Forsythe.
Thank you. Where do we steer business owners that have concerns and questions about mask mandates? I had a few calls today and I reached out to the county attorney, but where should I steer them?
Generally speaking, Dave, we have had Patrick Kelly assist, and he's sort of been the head of the reopening task force, which has been helpful to businesses, the Chamber of Commerce as well. But I see Steve's popped on there. Maybe he can give a little more clarity to what we understand to be the current requirement. Steve?
I sure can. Thank you. I don't know if any of you followed, but on November 24th, the state modified their original DOH regs. They modified Reg 2.6, not to be confused with 2.60, but 2.6. 2.6 made it such that the state could direct local health departments to engage in enforcement mechanisms associated with control of the pandemic, as well as response for isolation and quarantine. As you know, the governor announced that a mandate was being put in place associated with the mask, but instead of an executive order, which was the traditional way in which we saw it during prior response to the pandemic, it came in the form of a DOH reg, specifically DOH reg 2.60. 2.60 provides that healthcare providers have to be masked in a healthcare setting. PK through 12 has to be masked all day long. In fact, they removed what used to be known as the CDC 3-foot or 6-foot rule. Originally, it started out as 6-foot separation, then it turned into a 3-foot separation. Now, children at schools, from the moment that they arrive on school property until the moment that they leave, must wear a mask during the day. They used to have what were known as mask breaks. Give the children an opportunity during the course of the school day to be able to go without a mask. The new DOH regulation indicates that that mask break is not permitted anymore. There used to be a provision that allowed for employees, when they were seated at their desk, to be able to go without a mask if they were in normal operation. But that relief is no longer there. Used to have a vaccination out. Now there's a somewhat changed rule. The rule states that unless the business itself mandates that entry is conditioned solely upon vaccination status, that all entrants into the business or into the indoor structure in public must wear a mask regardless of vaccination status. So under the new DOH reg, the local health departments, at least according to the state, have been empowered to be able to engage in enforcement mechanisms by handing out $1,000 fines associated with the public health law for businesses that fail to comply. However, I just received notice from several other counties that 11 counties have already announced that they will not engage in enforcement, and B, there are separate directions that have been handed out to several counties indicating that the state is encouraging counties to engage in education rather than enforcement. So I believe that the board took that position previously when we went through the enforcement discussion. I believe the board directed that we try to help engage in education rather than come at local businesses with a heavy hand. I haven't heard anything so far from the board that would change at least what I perceive to be the direction, which is to continue to try to educate people about the need to try to be safe and try to avoid increasing infection rates. But as far as I can tell, there does not appear to be a large push by the state or by other counties for enforcement mechanisms that would include the levying of fines on businesses for failure to comply.
I see Mr. Forsythe with his hand up.
Just a follow-up. Thank you, Steve. So if I walk into a county building tomorrow, or the DMV or any agency, every employee is going to be masked. Is that correct?
If you're asking me what I believe the regulation document requires, I would say yes. The regulation document requires that public spaces actually have masks on.
Okay, and if I walk into the post office, the Stewart's, Sunoco, wherever, every person walking in is supposed to be masked.
Well, your first example was the post office, which is actually a unique example. That's operated by the federal government, and the state doesn't have the authority to impose obligations on the federal government properties. But if you were to go into Stewart's, or if you were to go into Walmart, if you were to go into a Price Chopper, yes, technically, unless the business requires proof of vaccination prior to entry, they're supposed to require masking.
So all the employees will have a mask, and all the people entering should have a mask on.
As it stands, according to the plain language of the DOH reg, yes.
Okay, thank you.
And Dave, you will also see that we'll have, at each entrance, we'll have masks available for folks coming in case they've forgotten theirs.
Right, and I appreciate it, Ruth. It's just, it's live now, and there's a lot of misinformation, I guess, and I just want specifics when people call me, so.
Absolutely.
So, thank you.
Yep.
Mrs. Ryder.
Well, thank you, Ms. Kern. If a department is 100% vaccinated, are they still required to keep their masks on? Would this be a way to incentivize our employees to get the vaccine, or is that something that we can't do?
So the hybrid of what we had before, the hybrid of that is no longer available. Unless, and Steve can clarify, unless you can demonstrate that everyone coming in and everyone in the location are vaccinated, it's masking.
Okay, everybody in the,
Yes.
Okay, thank you very
County
much.
administrator is correct.
Thank you.
Okay, just a couple other items I want to give updates on as well.
Could I ask Mr. Button one other question?
Of course.
Mr. Button? Mr. Button, I'm looking at, online today, and it's talking about frequently asked questions, on this situation that we're talking about. In particular, it's from the Health Commissioner's determination, page. And I was looking at it in particular on what is expected of the county in terms of who does the enforcement. I know you just discussed it a little bit, but it still seems a little vague after what you've said, and I just want to know if I got it clear. What I'm reading is, it is their expectations that New Yorkers will understand the importance of following this requirement as we enter this holiday season, where a surge in cases is expected. And enforcement will be done by the local health departments, and the maximum civil penalty of $1,000 fine. And so, are you saying now that maybe they backed off from our local health department being the enforcer?
Actually, Chairman, I'm not. What they have communicated clearly that enforcement is a discretionary function of the local public health department in consultation with their county attorney. They are not saying that enforcement is not a local function, but they are, from what I understand, communicating to counties that the ultimate objective here is education. They would like people to engage in this activity willingly, voluntarily, to mask up where available and not do so under threat of fine. The determination as to whether or not the level of fine would actually come from the public health department, the local public health department, not from the State Department of Health. Not to say that the State Department of Health does not have their own authority under this, but they appear to have made it quite clear that the enforcement mechanism they believe should be handled at the local level. So to a certain extent, the state has delegated that responsibility to the local public health department in consultation with their county attorney. Like I said, what I understand is they are communicating to counties that they would like the counties as a part of the enforcement measures to really engage in an educational component rather than the fine component.
Okay, well, I don't see those words delegated in what I'm reading online and so forth, and it's up to us, but thank you, I understand.
And we continue seeking clarity as well.
We lack clarity.
Yes.
Chairman, I'm familiar with the statement that you're reading from. I'm also familiar with the press comments that Governor Hochul made within the past 2 hours. And within the past 2 hours, she has specifically indicated that they will not force the counties to come down on their citizenry, and they will not encourage the counties to engage in activity that would be designed around fine structures, but rather around education. So while I believe that the Department of Health has issued the statement that you are reading from, the governor of the state of New York has indicated that she wishes to take a softer approach. So I'll take the governor at her word at this point.
Thank you.
Directors first, sorry.
So having heard that, I do not want our local public health to be issuing any fines. It's quite clear that the vaccines work, and we know that double vaccination or the 2 shots works better. And we know that boosters can play a role in there. And we know that the public here is fully aware. Virtually everyone knows someone that has died, someone who has been in the hospital. They've made their decisions. We keep creeping up in the vaccination rate, which I think is good. Now we're at 61%, 61.1 for 1 shot. People are going to, this is what this is actually putting pressure on business owners. It's shifting the responsibility from the individual to the actual business owner to monitor and police those who are coming into their business. And not only that, it's a detriment to someone actually here right at Christmas time when people are doing their shopping or whatever, their last minute shopping to get things for their family or prepare for the holiday season. It puts a real crimp, which is going to hurt our businesses. If people believe in the masking and they're vaccinated, they can wear their mask. If they're vaccinated, the reason they got vaccinated is because they didn't have to wear a mask. And the science shows that that is prevalent, and that's the majority of the cases. Certainly we have some breakthrough. So I am not interested in actually answering constituents about why they got fined by our local public health department $1,500 or $1,000 because they have made their own decision. Then they could be fined as they're vaccinated and not wearing a mask in a private or public space.
Thank you. Mr. Graham's next.
Okay, I'm gonna ask this question. I'm a principal in a corporation. If I open tomorrow night, can I expect not to be fined?
Mr. Button, are you still there? There you go.
I don't know, we may have to make an exception for you.
I'm not asking for
We'll all
exception,
come
I'm
down
asking
and expect
I get fined $1,500.
Mr. Fay, I believe what I was trying to communicate is that the objective as communicated from the state at this juncture is to engage in education. And they're not at this point encouraging fines. What the statement that Chairman Sheridan read from, if he goes back and takes a look at it, it specifically states that a local government may. That is a discretionary function. That word may is very specific, and I believe was chosen with great thought put into it by the Department of Health, demonstrating that the county governments are not under any mandate at this point to fine individuals. But there is a mandate out there to wear masks. The state is encouraging the wearing of masks, and they're doing so based on what they perceive to be extremely high numbers of positivity and hospitalizations at this point. So if we found your business to not have masks on at the place of business, Mr. Fay, I suspect the recommendation from the Public Health Department would be to engage in a degree of education, potentially a letter to you just informing you as to the Department of Health reg and informing you that you had an obligation to make sure that your employees as well as yourself are masked at that location.
Thank you.
Mrs. Haggard.
Two things quickly. First of all, I can't imagine our public health department having time.
Yeah, they don't.
Right.
They have 207 cases in the last 3 days over the weekend. They're busy. So I'm not going to worry about that. But I do know that the businesses in my area are very grateful that we're not shutting down. Putting a mask on is not going to kill anybody, hopefully. And the alternative to not having customers be able to come in at all, it's a small ask. Thank you.
Mr. Burke.
I would like to see our public health department have the degree of autonomy that they're supposed to have. They have a very sacred obligation to protect the health of the community. And let's take Danny's particular case. So they send him a letter once, they send him a letter twice. You know, should they not have a degree of, again, autonomy to decide what to do next if it looks like it's continually ignored? I have no desire to tell the public health department what to do, whether they choose to fine or they don't choose to fine. My expectation of them is that they protect the health of the community as best they can. And having said that, I would hope that the board wouldn't prescribe particular actions that they should take or shouldn't take. Because once again, who are we? I mean, this is their jurisdiction. Anyways, thank you.
You're welcome. I will say simply that I had a number of people reach out to me today asking if we were going to do a resolution condemning the mask mandate, and I said, no, we're not. What I would say is I've watched this go from if you get the vaccine, you don't need a mask, to, well, there are some breakthrough cases. I've seen people hospitalized who have had all their boosters. And the one thing that nobody hits on and nobody wants to discuss is natural immunity and who does have a titer that's positive and who doesn't. And the fact that maybe even if you have a positive titer, you might still be able to get this based on what I see. Because I know certainly people who have had COVID, got the shot afterwards, and it happened again. So I don't ever think that a mandate is what a lot of people want. But if I'm going into a store where it's tight quarters, I'm probably gonna have a mask on this season, simply because I don't really want COVID again. It wasn't fun. And so maybe people will think a little bit about it and toss a mask on if you're gonna be elbow to elbow with folks.
Sorry, that's okay.
As a healthcare provider, that's my thoughts.
Just a couple other items from the weekend with regard to the storm response. As of close of business today, there were still 1,174 in St. Lawrence County without power. We did have one displaced family as a result of necessity of food and heat. I believe they also will be put up this evening, and then their power is expected to be back on tomorrow. One, just to give a great mention to our departments, as well as all the agencies in the county. Our director put them on all call. They all manned their stations. They were able to respond, and it was a quick and difficult storm. Our emergency services dispatch worked tirelessly. They were in Messina and in Canton. Our sheriff's office, our highway department, buildings and grounds, and any and all who checked on vulnerable folks, Office for the Aging, Adult Protective. They're all aware of folks in need. When we know about it, we're able to respond. So I just wanted to mention that was assembled on the weekend. It happened quickly, but our staff stepped up, and as they always do. So just want to give a good kudos to them for this weekend, and still lots of work to be done. You had last month heard from us and from our emergency services director that you'd be seeing a plan tonight. And the reason that is not in front of you is one of the caveats that I provided to emergency services was to present this to the advisory boards first. And a joint meeting was held at the end of November with both Emergency Services Advisory and Fire Advisory, and your 2 representatives were present for those discussions, which yielded more input and the opportunity for us to make amendments before we bring this out in a public forum. So from this point, our hope is they're going to schedule district meetings. As you know, I believe there are 8 districts in the county, and they will be traveling around to present this plan and take input in person as best they can, socially distant and safe, to get input so that we can bring that back to you, hopefully January, but more likely in February, to have a productive discussion. Everyone agrees that there's a great need where emergency services and response times are needed. How we get there, as you might imagine, is very different. So I implored them to take all the input they could from the public, from these agencies who work together, who have to work separately, who have to deal with all of these challenges, and to bring that back so we can have a productive discussion about what a good solution would be. And then the board can determine at what level they could support it. Wanted to let you know, many of you the last couple of years have heard a lot about the Medicaid redesign team. I mentioned it during the vacancy, but they are rolling out some changes that may have impacts. My hope is we get some guidance on that from NISAC that I can share with you so that you understand the changes they're proposing to Medicaid and what that impact may look like for the county. I can tell you from the EF-MAP FOIL that I presented, I believe it was in September, that we have received finally a response back, and that number due to the county since 2016 is $4,018,842. So I am looking also at what other counties have shared to see where we fall in terms of the state owing counties for the EF-MAP reconciliation. Just a couple of other items. Wanted to mention to you that next week on the front end of finance, we have a special board meeting that we're going to schedule for 5:15. Our special board meetings do not typically include a citizen participation, so they will not. We have at least five resolutions to bring before you. This is also the last meeting of the year. Finance Committee will be. And then following, once we go offline from a public standpoint, Johnny and Jody Wenzel, our risk manager, will complete the trainings. We had originally planned to do that tonight, but we'll combine them next week so that you can get all your training wrapped up. And Jody's going to do some corporate compliance for us as well. Did want to just briefly mention to you as a follow-up to your support for the school resource officer program, the next steps, as you saw, this was a contract signature authorization in front of you tonight. What our hope is that for the 20th, we will know who and how many, and we can bring you budget modifications in the near future. But aside from that, what we'd like to be able to do is to put temporary positions so that folks can go to the academy. As you saw from the sheriff, the numbers are low. We're looking at most, I believe, 4 interested districts, but with likelihood of their proposal and follow through between now and the end of the year, we're probably looking at more like 2 or 3. So I'll keep you posted on progress. Next week, you'll have those numbers in front of you, but that also situates the sheriff's office so they could have folks in the academy in a timely manner. So your action tonight also allowed them to move forward with those discussions and continue their interview process of potential deputies to bring in. Are there any questions?
Seeing none.
I'm all set. Thank you.
Okay. To go on to the committee reports. Agriculture Farmland Protection Board, Mr. Denisha.
Thank you, Madam Chair. We had a meeting, Ag Farm Protection Board, it was a Zoom meeting on December 2nd. And there's a lot of discussion in regards to solar arrays and siting and thing. And I was unaware that there were between 2001 and 2016 nearly 250,000 acres of farmland lost in New York State. Most of that 250,000 acres of farmland lost was lost to renewable energy projects. So there was also a lengthy discussion on that assessment, taxation, solar projects. You know, one of the things that just a couple of comments that I want to share with everyone this is one of the board members, Green Power Initiative, which is good. You know, I think Green Power is good, but there's absolutely no thought, the removal of prime ag land. Can't eat electricity. We talked about removal of ag property. We petitioned by the owner. You know, and then you get into owner's rights versus preservation of farmland. You know, and there's just a lot of discussion around the loss of the farmland and potential loss.
Questions from Mr. Petition? Seeing none, on to the alternative for incarceration board, Mr. Burke.
There have been no meetings, so there's nothing to report.
Thank you, sir. On to the board of trustees for Supreme Court Library, Ms. Fiacco.
Nothing to report at this time. Thank you.
Thank you. Sorry. Kevin, do you have a question?
Well, I missed my spot, but I'd like to comment on Mr. Denisha's report. So 225,000 acres, that would feed about 100,000 cows or other food enterprises here. If you looked at these solar fields, it's highly unlikely that they'll ever be recovered and put into tillable. There is an opportunity for sheep farmers, they fence these in, that could be a plus. But what's happening now is our infrastructure can't handle it. So I can understand as far as the generation, it was my understanding, maybe Mr. Arquette could answer this, is that we're actually letting water flow through the dam and not generating electricity when these renewable sites come online. The power goes out to Chateauguay, comes back from the windows back to us. And so what's impacting us here is, here in the North Country, I know within a couple miles of my place, there's 200 acres of tillable ground that has been lost. And if you multiply that around, all this electricity that's being generated, it's not being utilized in St. Lawrence County. It's being sent to the city and other metropolitan areas. So we're experiencing a loss. The farmers are desperate. They're renting out or they're leasing out their lands for this. It's going to be impacting our food production. And so it's a real loss, especially when they're letting the water flow right on through.
So there, Mr. Arquette, did you want to say anything?
I believe what Mr. Akers was referring to is in the hands of the IJC and their plan for 2014. That's I believe on a 10-year cycle, and we've had if we have too much water up here, then there's not enough in Montreal. If we let it flow, then Montreal overflows, and it's again, I believe that a lot of that's in the hands of the IJC and their plan.
Go ahead, Mr.
So it's not about the water. The water is being maintained on the 2014 plan. So right now if you look at your report, I think there's 8,000 meters per cubic second. It's about actually water being let through or power not being generated because of the electricity that's coming on from renewables that's loading up the lines that the lines actually can't carry it. So fortunately, we have the 2 new lines coming on and that'll be able to handle more power. But what I'm saying is the impact locally here for what's being generated, the energy there, what previously was being generated was somebody actually utilizing a tractor, utilizing manpower, buying seeds, buying fertilizer, taking care of the land. All that sevenfold or tenfold use of that land is now diminished. And now it's just being used to generate electricity, which is being shipped to New York City.
So I listened to a very knowledgeable gentleman give me a good description and a kind of an explanation of how the whole New York ISO works and the different percentages and how to read the map that's online. And if everyone is interested, or if the majority is interested, I would approach this person to see if they would come and give the same sort of explanation to the board, simply because there's some truth to water being dumped when we have too much in the grid. There are some days that we turn on these little cogen plants because there's not enough electricity in the grid. I forget which day in August it was, but we were really kind of at the curve of where we might not have enough electricity, period. But is there an interest from people to have that kind of an explanation? Because part of his discussion was, there's a big hurry to get rid of these natural gas cogen plants, when one cogen plant can make 50 to 80 megawatts. I'm always lost there, but, and it would take several thousand acres to begin to make half of what one little cogen plant can just put on and make. So by a show of hands, anybody interested in a presentation like that for just our own education? I think we have enough there. I will approach the person. And Ruth, I'll talk with you to see when we can maybe add that in.
Okay, that sounds good.
Okay, edification was the word I was looking for. All right, that ends on to emergency services. So Larry and I had a wonderful joint meeting with everyone in fire and rescue, and Jonathan gave what I thought was a very impressive presentation about his plan that he had came up with, and everybody's hand went up and said, no, that's not what we want to do. Because then this plan is in direct competition with us, right? Basically, that was it. And we don't want extra people competing with us, and we don't want the county having its own ambulances. And if anything, we would want you to use our ambulances, and couldn't the money go for training? And why didn't you come to us first before you talked about it? And what else am I missing?
Salary enhancement, right?
Training, I think, is part of it.
Training, they talked about training, but there was more than that.
Well, yeah, training was a very big part of it. You know, I think Tom theme was, it's not a shortage of ambulance, it's not a shortage of emergency vehicles in San Luis County.
Sure.
Ambulances and fire trucks, it's a shortage of people to fill seats.
And if we hire some, we're just gonna take people from their company and put them over in our company, but we'll still be missing the amount of people it takes. So they talked about getting us together to maybe pool resources and pay for education, and I know there was something with that because Clarkson has a program, so we can't have our own certificate to train people.
But there was a real good point.
You, absolutely, that's what I'm looking at.
Real good point was made, because it was in regards to the training, with BOCES. The BOCES, and that's where the interest starts, when you get the younger folks, they get interested in the fire service, the emergency services, law enforcement. And BOCES, they offer nursing programs, they offer dietitian programs, they offer carpentry programs. Why couldn't BOCES offer an advanced life support course or a BLS, basic life support course? Take advantage of this when there's an interest. So then when kids can go to BOCES, because there's a lot of kids that are interested in it. And once they get in the workplace, you're looking at the training. The training requirements are so onerous that most young people can't afford to take the training because they can't take time off from work. So I thought it was a really great idea. And Ron was there that evening and thought it was Ron Burke and thought it was a wonderful idea, as I think everyone did. I know the folks that are going to look into that, and I think it won't be the whole answer to the problem, but it will certainly help.
2 years ago at NISAC, they had a New York State fire, I forget what the name of their whole thing is, but they had a film that they showed us, that they showed the kids in high school. Is there a fire within? And it talks all about, like, are you interested in helping the community? Are you interested in getting involved in this? And maybe a lifetime of, working with the fire department, emergency management. And I mean, I don't know if we could come up with something like that. We might even be able, you might even be able to talk to the people at the New York State Fire, and they might even let us show stuff like that that they have already made. And I'll reach out to emergency services, but one of the problems that we have in New York State, I didn't know about this, is kind of humbling. There's a mandate for the fire protection you have to have, a mandate for police protection you have to have, and absolutely nothing that says or funds needing to have emergency services in your county. Which is why there's not a lot of money for emergency services in the state or in the county. Anything else there?
Yeah, I think everyone agreed that it was a good, everyone agreed that it was a good. Well, not a lot of people agreed with the plan that Jonathan presented. Everyone agreed that.
He had worked hard and did a good job.
That it was a start.
Yep.
So,
And he did work really hard. It was very impressive. It was very detailed and very well thought out. So I want to give him credit where credit is due. The Environmental Management Council, did anyone have a report from Ms. Nelly? Or we'll get it next time? Okay, we'll get it next time. Inter-County Legislative Committee, in November, we talked about, NACO did a presentation, just about basically the broadband, how the different people were gonna have the grants that Margaret talked about. They got an another inter-county association that sent them a resolution urging Governor Hochul and Commissioner Zucker to modify the pending COVID-19 mandates for all healthcare workers due to the shortages. That was passed by Allegheny, Cattaraugus, Cayuga, Chautauqua, Chemung, Erie, Genesee, Livingston, Monroe, Niagara, Ontario, Orleans, Schuyler, Seneca, Steuben, Tompkins, Wayne, Wyoming, and Gates counties. They did not take that up. And in December, there is no meeting, so we'll be back in January. Jury board, Mr. Sheridan.
Thank you, Mr. Chairman. Jury board met on December 3rd. The Honorable Mary Farley was there. She chaired the meeting. The Honorable Greg Story was there. Myself and the Commissioner, Melissa Sweet. Discussion was had about the low number of jury trials scheduled this year due to the COVID-19 pandemic, because there's only one courtroom designated by OCA, Office of Court Administration, with the physical space needed to socially distance the jurors. Criminal jury trials are scheduled during odd numbered terms of court, and civil jury trials are scheduled during the even numbered terms of court. Commissioner Sweet advised the grand jury is going well. They're meeting one day a week. Grand jury still meeting in the board legislators room here. As room 226 is not large enough to socially distance the grand jurors. Grand jury selection and panelment is taking place in the boardroom as well. Ms. Sweet advised that the sharing of the grade 12 position with Franklin County Commissioner of Jurors Office is going well. Lynn Zakota is a great asset to both counties, and Ms. Sweet shared that her tentative plans to retire in the spring of 2023. That's I think all you need to know.
Any questions for Mr. Sheridan? Seeing none, we will move on to the planning board, which is Mr. Fay, but Mr.
Our planning director still with us.
Is Photopower still? Thank you, Jason.
Thank you, Jason.
No problem, Danny. Good evening again. Just a quick update on the county planning board. Met last week, the 9th, Thursday, the 9th of December. Reviewed two projects, development projects, a new storage store in the village of Potsdam, the corner of Cottage Street and Market Street is where that store is proposed. Also looked at a storage unit development, a creative adaptive reuse for a a store, a vacant store in the St. Lawrence Center Mall. It's going to be converted to a storage facility where there'll be storage units could be rented. Their dimensions are 10 by 10 feet by 10 feet. So similar to containerized storage, but inside the mall. We also adopted our 2022 work program. I always try to do that in December, so we're ready for the new year. Elected our slate of officers, which happens every 2 years. County Planning Board officers serve 2-year terms, so we have a new chair, a new vice chair, and a new secretary for 2022. And lastly, we just reviewed the training program or training event that happened on the 7th of March, where we offered training for local planning board members and zoning board members across the county. Had a good turnout on that for that training as well. So happy to answer any questions on planning board activities.
Seeing none.
Thank you.
Thank you very much.
Thank you.
Merry Christmas.
Welcome. Thank you.
Okay. Next, we have old and new business. Does anybody have any old business? Mr. Burke?
Last meeting, I brought up, the issue of sales tax on heating fuel. And I had an opportunity to speak with Steve today. And it certainly appears that there are there's an extended protocol that has to be facilitated before we could do this. And I'd like, if Steve, if it's okay with you, Rita, if we could ask Steve to talk to this so that we all know what the constraints are.
And he may have stepped away just for a minute.
Mr. Button there.
He may have stepped away just for a minute, Rita.
Can we
Well,
can we come back to that when he pops up?
Well, I can paraphrase what he said.
Okay.
He said, best case scenario, all the steps taken, it would be 1st of April, which puts us beyond the heating season. And I guess, and I mentioned this to Bill, because Bill was in the process of appointing a committee. And at least for me, rather than, we have no idea what we're going to face next fall. So it's very hard to plan for that much down the road. And I'd like to suggest that maybe we look for other ways to help the people because this doesn't seem to be expedient.
Does anyone have any questions for Mr. Burke on that? Mr. Akers?
Just a procedural question then, because your resolution is tabled to
Finance.
Next week.
next board meeting, right?
Yeah.
Next,
No,
Yeah.
finance, next week.
Was it?
No.
Okay.
And someone else had their hand up? Secretary, no. Okay. Do you have a question?
Yeah, just a thought. I know when we first, there was some, we passed a resolution, well, for the full board meeting. For, I think we had it for I think it was $580,000 that we received for weatherization. And that may be, it's the fuel or the home heating fuel, whatever it is. Another way around it may be to increase the amount of money that's available for weatherization projects.
So do you still want that committee to do something? To talk about it?
So, just a thought.
Sorry.
So, actually, Mr. Baker brought that up in our meeting today, our committee meeting. American Rescue Funds is certainly something we can look at.
Okay.
If it applies.
Anyone else have any old and new business?
So in other words, we don't need to officially put this committee together. Is that what your feeling is? We're all set to go. We got everybody involved with but I won't make the announcement tonight on those. It's okay with it.
Any other old or new business? Mr. Reagan?
following up on that weatherization question. Could we ask CDP and social services, in North Country Housing Council, if, money were made available for weatherization in order to expand the number of households who could get that assistance? Can we get an idea of what their capabilities would be to handle an upsurge if we had the money available? Because it's pointless to appropriate X amount of money and then find out a year from now, oh, only this much was spent because we didn't have contractors, we didn't have this, we didn't have that. Let's, if you could find that, see if you can find that out so that, you know, if we do make money available, it's used wisely. And plus, the money, we can appropriate the money over a 3-year basis. So it can be each year an increase in the number of households who can benefit from the program. I just, you know, I think it's important that, you know, this is a one-time thing, having this, and if we can get the most bang for our buck, benefit the most families without, you know, having money go to waste, without having, you know, folks who are not qualified to do the work, hired, you know, I think it's important that we use the money wisely, as we try to, accomplish our goal.
Can I, just for clarity, CDP, North Country Housing Council, I thought there was one other you mentioned.
Check with the planning office, see who they think is capable of assisting with this, you know.
DSS.
I don't have all the answers.
Thank you.
Wait, yeah, wait.
Wait, Mr. Forsythe has a question.
Well, it's not really a question. It's just a response to what Jim just mentioned was right now is probably the worst time to invest in that type of project. Lumber prices just in the last week to 10 days have gone up 35%. That was prior to the 4 states getting bombarded with tornadoes, which is gonna, I can't even imagine after watching the news how that's gonna wreck the supply chain for lumber and building supplies. Just building a garage this last month, you can't get materials, you can't get conduit, you pay through the nose for wire, it's everything. So I'd strongly encourage you to just wait a little bit and hopefully it comes back, because I'm afraid it's gone, but hopefully the prices come back to some reasonable amount. It's terrible, really terrible.
Everything except for cement. Anybody else?
Are we on old or new business? Or both?
We're still on old or new business, but if you have new business, you can just pipe right in there.
So just a new business. If you look at the number of deaths, 150 from COVID that's been recorded, and you look at the 16,214, if you believe that that's all that have been exposed to COVID, the mortality rate is 0.00925.
And that's not counting in natural immunity people. Anybody else? New business? Mr. Perkins?
This is just in response to Mr. Perkins, the heating fuel tax. We have over 8,000 individuals on heat right now. I'm sure it'd be better to take care of the heating fuel by increasing the income threshold for these people, because I can't see taking the sales tax off for everyone. If not everybody needs it, it's just gonna put the tax burden back on the property. So I would sooner raise the income threshold for the working quarter, as we call it, and work at it that way instead of eliminating it. Just a thought.
Okay. Anybody else? Old or new business? Once, twice, 3 times. Do we have a need for executive session?
We do for litigation personnel, for the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation, negotiations, and appointments. Please.
Do I have a motion to go into executive session by Mr. Smithers, seconded by Mr. Perkins? We are in.
Announce the names of the people who are going to be on the,
Is that for
Family
open
court.
session, Mr. Chairman, or is that in
Yeah,
executive?
it's open session.
Okay, so
Rita,
just
Rita.
move on, so just hold this a second.
Rita, we need to
For
vote
the,
on we have a motion and a
committee.
second, but they didn't vote to go back
Oh.
into open.
Can we have a vote to go back into open session, please?
You got your motion in a second.
Okay, all right, go back into open session, and then Mr. Sheridan has an announcement.
Open session now.
No, it's not yet. They
Yeah,
gotta
get
go
back
back
online,
online.
We're okay.
We are.
Okay.
We're good.
Okay, go ahead, and then I have to read my little thing.
Thank you, Mr. Chairman. The family court issue, where we've discussed whether or not we should be seeking a new family court for St. Lawrence County. That committee, the chairman will be Nicole Terminale. James Reagan will sit on that committee. Suzanne Fiacco will sit on that committee, and Harry Smithers, and I'll be the ex officio.
Okay, perfect. Anyone have any comments about that? I just need to read these little second appointments. So as a second appointment announcement.
Oh, you don't do that.
Oh, I don't have to do that?
No.
Okay, all right. Then I have a motion to adjourn by Mr. Reagan, seconded by Mr. Fay. We're done.